I think I got this bald spot going on here. Hey, what is up? Hey, we're looking a little different around here. So, how y'all doing? It is 5:30 Texas time. 5:30 Texas time. Waiting for everybody to get up in here. Yeah, today is Monday. So, as TikTok starts to do its thing, yeah, we'll let TikTok do its thing and see what's going on. So wait for everybody to jump up in here and see what's going on. I'm about to see what's going on. See what's going on. I got one person up in here. Hey, shout out to you. You'll probably disappear in like 5 seconds, but whatever. I mean, that's all out of love, though. That's all out of love. I hope you stay. I hope you stay and hang out and ask questions and be a part of the conversation when it comes to nursing, or if you're a nursing student or anything like that. So I got 5 people in here. Shout out to y'all. Well, we're going to get everything kicked off. We just want people to jump in and join, and then we'll get stuff kicked off. See how y'all are doing. Hey, welcome to the TikTok Live. You're studying for NCLEX? That's what I'm talking about. Studying for NCLEX. That's what I'm talking about. Which NCLEX are you taking? NCLEX RN? You taking PN? Hey, shout out to you. The goon is here because she be fighting fools. You know what I'm saying? There's Cash. Shout out to you. RN, okay. So you're taking the RN. Hey, what's up? I'm going into my 3rd semester. Shout out to you, Josie, going into your 3rd semester of nursing school. I don't know how many semesters you have. When I went to nursing school, we had 5. So if you have 5 semesters, you're into your 3rd semester. So you're about to be 60% done. Oh, 4? Oh, so you're what? 75, almost 75% done. So look, hey, you're heading in the right direction. All right. So just remember that the finish line is there. This is the hardest part is always the end. And the end when it comes to a nursing student or being a nursing graduate is passing that exam, passing that NCLEX. All right. So Aisha said, you're done on Friday. Done with what? Done with school on Friday? Like you done with school? You graduate on Friday? And you about to go take that NCLEX, Aisha? That's what you're telling me? Is that what you're telling me? Shout out to all 17 people that are up here. That's what I'm talking about. That's what I'm talking about. Hey, I want you to, this is kind of metaphorically, Aisha, I want you to just look behind you and just realize like the road that it took you to get where you at right now. You know what I'm saying? Shout out to you getting your BSN. But I want you to look and just be like, look at the road that it took for you to get here. Look at the journey. You see what I'm saying? So now you're about to hit that next milestone, which is graduation. You're about to have that nice little diploma that's right there. You know what I'm saying? And then boom, it's off to NCLEX. Okay. So keep an eye on the prize. Keep pushing through. I'm taking NCLEX for the 3rd time next Tuesday. Shout out to you, Cheryl. You want to know why? Because we don't quit around here. You better let them know. Better let them know we don't quit around here. Hey, and anybody that's new in here, y'all better let her know that I don't let nobody quit around here. You don't quit around me. So shout out to you for going for your 3rd time. Longest, hardest road ever, but it's about to be worth it. Thank you. You're welcome. You're welcome. Hey, I'm all about spreading positivity as well as just honestly just keeping it real. Keeping it real and letting y'all know what's up. Since you take the NCLEX. Since you take the NCLEX for a 2-year program, do you take it again for a 4-year program? No. So who is that? I'm just gonna say Guy. If you take if you go to a 2-year RN program, right? Like the ADN or ASN or whatever they like to call it, it is the same NCLEX that you would take if you were a BSN. So no, you don't. It is the same NCLEX exam. Now, if you were an LPN and you took the PN exam and then you went to an ADN program, you would have to, or a BSN program, you would have to take the NCLEX RN, which is a different test because the scope of practice is different. So hopefully that answered your question. Shout out to all 109 of y'all. First of all, there's 109 of y'all in here and I only got 4 likes. What's wrong with y'all? Hey, do it now. Smash the like button. Or if y'all don't know who Nurse Cass is, she's another one of my moderators that likes to jump up in here. She will go to your DMs and she will fight you. I'm just letting y'all know. Shout out to her. Usually I play Nuck If You Buck, but last time I got copyright strike when I put it on YouTube, so I might just kind of chill on putting that out there. But shout out to all 85, 86, or 100 people, however many people want to be up in here and listen to me run my mouth. But if y'all have never come to this live stream before, my name is Kevin. I go by the Boot Nurse on all social media platforms. I am a nurse. I've been a nurse for 3 years. I specifically work in the operating room. But I want to know about y'all. I want to know who you are, where you're from, where you're at in your nursing journey. Are you taking the NCLEX? You're about to start nursing school. You're talking about doing prerequisites. Are you already a nurse who has been working in the field for a long time? See what I'm saying? Let us know all that knowledge that you got. Hey, shout out to Nurse Nelly. She's my other co-host who likes to hang out in the chat, and she will answer all questions that I don't get to. Same thing with Cass. She'll answer them all. Nurse Nelly has been a nurse for 4 years. She has also worked in, where you worked at? She worked in Med-Surg, Tele, ICU, and now she's a case manager, loving her life. Nurse Adrian's up in here. If I remember, Adrian, you do something with legal. I remember we were talking about that last time. You do something with legal. I just know that she's all about documentation and all that good stuff. But Nurse Nelly is a case manager and she's out here loving her life. Now, Nurse Cass is out here, working in psych and working in correction. So I just want to let y'all know she do got hands. So try Jesus, not her. You see what I'm saying? Shout out to everybody that's up in here. And if you're a brand new nursing student who's about to start nursing school and you don't take your NCLEX for another year, 2, 3 years, check out the 7-day NCLEX course. It's the course that I created. It's going for $48, which is 80% off. Once you get it forever. It is in a pre-launch phase, and I am consistently updating it as time goes on. So shout out to everybody that is participating in that. I recorded like 8 videos yesterday. We're about to get those edited and they're going to be up on the program. So be on the lookout for that. So let me see what questions y'all are asking me, because y'all are asking me a ton. Josie said, what are tricks for medication calculations? So for our dosage calculations, medication calculations, honestly, dimensional analysis and just practice, repetition. I was never the greatest at doing dosage calculations because me and math don't math well. I don't know why. Just the numbers just don't work out well for me for some reason. I don't know why, but it took me a lot of practice in order for me to just even get it down. Like I can put hands on patient and I can do all those skills very well. I can understand a lot of the whys, but then the numbers, even though they don't lie, they just weren't really in the cards for me. I'm just trying to figure out my life. So here's a nice little trick. For the majority of the time, pharmacy will do it for you, but not on NCLEX. So I would definitely tell you that it takes lots of practice. Okay. Tony said, new grad here, a month and a half in the OR, and it's the best. I bet it is. Tony, tell us why it's the best. When do you do manly stuff? I don't know what that means. Is that sheave palatine? What does that mean? Do manly stuff? A quick question. What are the eligibility criteria to apply for NCLEX? I'm a foreign trained doctor. So in order for you to to meet the criteria for NCLEX, you must go to an accredited nursing school. You must pass that nursing school. There's a background check that you have to go through as well as fingerprints. All different types of stuff that you have to go through. Like I said, criminal background, pass school. You have to graduate. And you have to meet all the criteria within school in order to graduate, have that diploma, that degree, and your institution of higher learning will then send that to the board, to your local or your state's board of nursing, and they will determine if you meet all the criteria. And if you don't, and if you miss something, you have to provide them whatever information. It's actually started to get a little bit tighter now because of the whole Operation Nightingale thing that happened just recently with a lot of the fake nursing situations that happened in Florida and Georgia. I'm just keeping it real. I know Sasha's not here. Sasha's my other co-host, and she'd be the one, stop talking about Florida, Kevin, oh my God. But I'm just keeping it real. So that's the criteria to apply for the NCLEX. That's what it was. A concierge, patient advocate, and regulatory expert. Long list. So we'll just call you a legal nurse, Adrian. We'll just do that. My husband is an X-ray tech now studying for MRI. Hey, shout out to your husband, because MRI and X-ray or anything radiology, that's where that's where they make the monies. Is it Dana Ray? And I'm starting my prerequisites on September 5th. Shout out to you. There goes Sasha right there. What's for dinner? Don't know. Learn math like a language. Facts. How's our wife doing and what's for dinner? Look, first of all, I'm gonna need for y'all to stop. All right. I'm gonna need for y'all to chill. What if I had $1 for every time I had to figure out drip factors because of no pumps? That's true. You better know those drip factors for sure. Hello. I love you. Sure. I love you too, I guess. Took my NCLEX Saturday and I passed. Shout out to you, Queen. Everybody shout out to Queen. Give her some love. Let her know. Welcome her to the shit show of being a nurse. And I mean that in the most respectful and great way possible. What else we got going on, huh? Thank you. What do you think of schools that don't require HESI or TEAS? I personally didn't know that the schools didn't require HESI or TEAS. Now, most people, or I would think that if a school does not require you to take the HESI or TEAS, you might want to check on that school's accreditation. Granted, all schools are different, but I definitely want to make sure that that school is accredited with the state's Board of Nursing, because if it's not, then you're going to end up going through a school, paying these people all this money, and you're not going to get a degree, or, some craziness could happen to you. And I definitely wouldn't want that. Hi, I'm Sasha, Peds OR nurse living in Orlando. Yep. Hey, by the way, Sasha can get everybody in here into Universal and Disney World for free. Just letting y'all know. While I'm here, ultrasound is another money. Yep, facts. Anything radiology, it has a lot of money in it. So let's go, Queen. It says, peace, brother. I am a recent LPN graduate, waiting to take my NCLEX. Any advice for going to the OR or ED? Well, Mello, it all just depends on where you want to go. Do you want to go to the operating room, or do you want to go to the ER? They have specific OR sections depending on what type of hospital that you go to. You can do OR trauma, where they do a lot of the trauma surgeries, like the emergency surgeries, like craniotomies, or exploratory laparotomies. All the crazy things that happen like on an emergent basis. And of course, if you want to go to controlled chaos or just all fucking chaos, then you can go to the emergency room. It just depends on what your speed is and what you're looking for. Are you on YouTube? Adrian asked me if I'm on YouTube. Yes, ma'am, I am on YouTube. I have that link in my bio. But if you don't want to click on the link on the bio, you can just go or type in the search engine in YouTube, the Boot Nurse, and I'll pop right up. What else? What else we got? Finished nursing prerequisites 4 years ago. Have a 4.0 GPA. Nervous about starting a nursing program again. Prereqs 4 years ago, and what are you nervous about? What you nervous about? You did your prerequisites 4 years ago. You weren't nervous about getting through those. You got through them. You got a 4.0 GPA. So you shouldn't be nervous about applying. Just apply. Because what's the worst they can tell you? No. They tell you no, apply for another one. They tell you no, apply for another one. You'll probably get 9 no's before you get one yes, which is okay. Because eventually somebody's going to say yes. It's a part of your journey. It's a part of the road that you're going to be traveling for yourself. I applied for like 10 schools, got accepted to like 4 of them, and then I obviously went to 1. So all this depends on what you want. Agent said, thank the Lord I didn't have to be a CNA volunteer or take TEAS. Nope. Oh, okay. Shout out to you. I had to take the HESI, so there's that. I'm already getting nervous for my NCLEX, and I'm in the final year of nursing school. Any tips? So here's one thing I'll tell you. I cannot read your name because it's in a different language. So here's what I'll tell you: is you're in your last semester of school, or you're in your final year of school. Before you graduate, I'll say about a good 2 to 3 months. Definitely start honing in on NCLEX style questions, as well as content to apply towards your NCLEX style questions. That would be my biggest thing. And then, of course, practice, repetition. I'm just keeping it all the way real. You can't stand me. What do you mean? Don't be that way. Not again, first time. Okay. OR is life, facts. Okay. Bet, thanks, bro. Yeah, no problem, Mello. Advice on retaining info in nursing school. I study all the time and still feel like I'm drowning. All right. So, Lele, here's the thing for you. What type of learner are you? Think about that. What type of learner are you? Are you auditory, kinesthetic? And auditory obviously means listening, kinesthetics hands-on, visual, obviously you visually see something, and then you can repeat it back. Are you a read-write? Are you a combination of all 4? One thing I can say is I like to listen to podcasts now. So you could very well retain certain information on your drive to and from school, to and from work, if you listen to material that is relevant for what you are trying to learn. So if you're learning about fundamentals, find you a fundamentals YouTube channel. If you're learning about med-surg, find you a med-surg channel. Think of those different ways that you can retain stuff. Like I got radical with mine at one point to where I would put it really low next to my bed and I fall asleep, and then all of a sudden I'm just like, man, like what is it about SSRIs or MAO inhibitors about tyramine? They can't have food and with what? And it just kind of sank in like that. So think of those alternative ways that you can learn to where you can retain knowledge, because not everybody is good at reading a book. Let me tell you, if I broke out this book or many of these books that are right here, I promise you I'm falling asleep within 10 minutes. That's the best way for me to fall asleep, is to break open one of these books. I'm just keeping it all the way real. So Lele, I hope that helps and that answers your question. What do you do and how much do you make a year? Well, Anthony, I'm a nurse and I make just enough. What is a day like in the ER unit? I haven't worked in the ER since I was an EMT, But I could tell you that shit could be wild. It could be real cool. And the next, boom, trauma, boom, trauma, boom, trauma. So it all just depends on what comes in. Jake102 says how to pass the T's. I would recommend the Mometrics yellow book that you can get off Amazon. It's like $33. It's a really good book to study for T's. Do college credits expire? I don't think so. That's a good question. No, I don't think they do. What skills will you want to refresh before starting in the ER? Definitely IVs. Definitely IVs for sure. Definitely an assessment, like when you do your head to toe assessment. You definitely want to learn your rhythm strips for sure. So you need to know because not everybody that's going to come into the emergency room is going to come in from a car accident. You'll have some people that are going to come in with STEMI. So they're going to come in AFib RVR, or they're going to come in, with asystole. They're going to come in with a Lucas. And if you don't know what a Lucas is, essentially it's a hands-free compression device that does chest compressions for you. So you just got to learn. You got to learn a lot. I think they expire in 5 years. I don't know about those credits. So, Jake, I answered your question already. I applied to 6 schools. Be willing to move, do whatever it takes. So now that's an issue. Some people are just like, I've been wanting to go to the school of my dreams. Don't nobody give a fuck what dream school you want to go to. Because in the end, no hospital is going to care what school you went to. They just want to know, A, you got this degree? Now, as a matter of fact, they don't even care about that. No, they do care about that. But A, do you have a license and is it legit? That is what's important. You can go to a community college and get an ASN degree and get an RN license. It does not matter. It does not matter. I promise you. Any of the nurses in here can tell you it does not matter what school you go to, as long as it's accredited and as long as you get your license or your degree and then your license. That's all that matters. All right. I'm already getting nervous for the NCLEX and I'm in my final year. I already answered your question. I'm just doubting myself and nervous since I'm 27 years old and I haven't studied for 4 years. Why does everybody keep throwing age up in here? Like everyone keeps throwing age up in here. Like age matters if you're going to pass this exam or not. I've literally been in college with women that are like twice my age, in their mid 50s, and so don't use your age as a crutch to not be successful. And I'm not saying that you are, but if you haven't studied in 4 years, hey, it's just like riding a bike. Get back into the routine of doing it. And once you get back into the routine, it'll seem normal to you. So if you haven't been to nursing school will humble that ass real quick, as well as get you into a routine really fast, okay? How you prep for the TEAS exam for free? YouTube. All it takes is one. Yep. Thanks, ladies. It was 6 years ago. Got you. Thank you so much for the tips. You're very welcome. You better love me too, H1. Oh my God, this guy. Really, Blanco? Of course I love you, bro. I got you. How are Gen Z job hunting? How are Gen Z's job hunting? I'm out here looking for jobs and it's absurd the loops yet so many jobs. Man, I cannot read. Adrian, I think what a lot of people are doing now is LinkedIn. So a lot of recruiters are actually coming to them. So can I leave AMA from work? Hey, shout out to the emo nurse. That's my other homie / mentor, the emo nurse practitioner. And no, you cannot leave AMA from work, or else they're gonna fire you, and we don't need that. ADN versus BSN, my opinion, doesn't matter. Get one because it's the same RN license. Because if you get your ADN, you can move up. You get your BSN, all right, cool. You can either chill or then you can move up and get your MSN. Doesn't matter. Mello says Mark Klimick is a good listen. 100% a fact. I listen to Mark Klimick all the time. What is it? Mnemonics help a lot. Facts, they sure do. I like Picmonics mnemonics because they're picture mnemonics. So a lot of people are visual and they remember the mnemonics that they drop out. So I get sponsored by Picmonic, but this is not a Picmonic sponsored live stream or anything like that. But they're pretty good. Not good at reading books, so I look at YouTube. So that's just another way that you retain information, Cynthia, for sure. Do you have an NCLEX prep? I'll be done with RN school in October. So I do have an NCLEX course. It is the 7-day NCLEX course. That link is in my bio. You get it for $48. But I am telling everybody right now, all 51 of you, that it is in the pre-launch phase. So it is not complete yet, but it gets updated periodically, at least like once a week to once every other week with content. So be aware of that. But for $48, you get it for free. So think about that. What does it say? I just seen behind you your coins. Are you in the military? Did you use your GI Bill? Yes, I'm still in the military. I've actually been in the military. Next month it'll be 16 years. And I did use my GI Bill for me to go to nursing school. As a matter of fact, I used 18 months of my GI Bill. So I still have like 18 months, 27 days left on my GI Bill. So when I want to go for my master's, that's going to pay for it. And then if I decide to go to the doctoral level, it'll pay for some of that as well. Do what expire? I don't know what you mean. Different schools expire at different times. Mine, farm. So I know a good rule of thumb that they say science classes expire, I think 5 to 10 years, but it all just depends on the school and it depends on the state. Can you have an LPN from another state, but work in a different? Yes, you can actually. So that's what we call the nursing licensure compact, which means that you can get your license in any other state and you can work in those states that are a part of that act, which I believe there's like 41 of them now. Credits expire generally after 10 years, vary school by school. There it is. I went number 3 in NLL and nobody cares. There you go. Hello. Only in the associates program do you need to retake the sciences. I have an ADN. You mean you had an ADN, Jana? Nope, I have an RN license and I'm an associate's degree nurse. Yep, you sure are. Only VA cares and wants every detail of your experience for your rate. That, Adrian, that is 100% a fact. Same thing in the military. The military will not take associate's degree nurses. They only want baccalaureate leveled nurses. And depending on the branch, you need to have a specific amount of experience before you can go into the military. Hi, I'm 34. Hi, not me. Already answered that question. Look, I'm 55. You are not 55. Adrian, stop lying out here. You ain't 55. We ain't got Alzheimer's. Hey, I'm just saying video games are good for the brain. I'm just letting y'all know. How to prep for the HESI exam. So a really good book. Another one, I would recommend the Mometrics for HESI. Or it's Trivium. It's a Trivium book, and it has like a couple of people on it. It's like blue and green. I'm gonna make a TikTok and I'm gonna put it on there so that way everybody can see it. I know I've been saying I'm gonna do that for like 3 weeks and I haven't done it, so I'm sorry. Already answered that question. Mallory, hey, how's it going? How are you? Adriana, having your BSN allows for more job opportunities. Yes and no. Mostly with BSNs, when you're in a hospital, they want to see that. Okay, so with a BSN, that allows for you to go up the clinical ladder, if that makes sense. So the clinical ladder is essentially those step-by-step processes for you to move up so you can get more money, or you can get leadership positions like being the manager, or you want to be the director, or you want to be whatever the fuck. So that's what the bachelor's degree will get you. But if you want to work as a nurse, doesn't matter. Guess what? Go get your experience a year or two or wherever you are, and then go away. And by go away, I mean go travel or do whatever. Or, hey, you can go do a strike. I didn't tell y'all that because people don't like the fact that, I guess I'm a scab. I don't know what that means. I did cut myself on my leg the other day. I don't know what I hit, and it's kind of scabbing over. It actually kind of hurts. But anyways, I don't care. Shout out to all 52 of y'all in here. If you guys are brand new to the live stream, my name is Kevin. I go by the Boot Nurse on all social media platforms. So I ain't playing. All 55 of y'all need to go follow me on Instagram, on YouTube, on Thread. I don't even get on Thread like that. I don't even have X anymore. X gonna give it to you. RIP to DMX. Anyways, so yeah, I want to know who you are, where you're from, where you're at in your nursing journey. Studying for NCLEX, pre-nursing student. All my nurses that are in here that got all that experience, make sure you guys drop all that down in the comments because we're trying to foster a great environment up in here. And plus, why not give back to individuals that are essentially trying to be like me, like I was trying to be like them. So what we talking about down here? What we talking about? Does it help with peeing? Does what help? Is it Tasha or Tasia Williams? It does help with peeing. So here's the biggest thing that you guys need to know in the difference between being an RN and an LPN when you're taking your NCLEX or LVN because they're interchangeable for LVN and LPN. But you need to know what you can and can't do. That is literally the biggest difference. You need to know what you can and can't do, what you can accept and not accept. You can't take unstable patients. You can only do certain sterile activities, such as you can do a Foley catheter, but you can't do a central line. Does that make sense? So, and it doesn't matter. It doesn't matter what certification that you may have as an LPN or an LVN. Doesn't matter. When you take the NCLEX, the National Council of State Boards of Nursing does not allow it because it is set at a standard, even though different states have different criteria. Okay, so think about that. That's amazing. Thank you for your service. I appreciate your support. Thank you. Ashley said, thank you. Yup. I'm in the state of Indiana. Do you know of any financial help for the rest of my LPN program? Man, there is. I don't. There's a program. It's like a government program. I think it's HSVS or something like that. They'll pay for you to go to nursing school, but the caveat is they will send you where they need to send you. So they mostly send you like very under popular, those areas that need help. Obviously, I don't know how to talk, but they'll send you there. So like, very densely populated and not, it's like such good places to go to. So there's that. What it said, I said, love these lives, very informative. Thanks for the positive words to push through and not be nervous. So all it takes, in order for you to get through the nervousness, I promise if you practice and you train, by the time you go to take your exam or by the time you do anything, it's going to feel like riding a bike. It really is. TC, any advice for an 87-year-old grandma who has the hots for a stud muffin like you? Join my OnlyFans. Joke's on you because I ain't got an OnlyFans. If I get 10,000 likes, I might make an OnlyFans just for y'all though. Just for. No, I'm just playing. We don't do OnlyFans like that. Maybe I sell some feet pics. Anyways, don't get distracted. Let me see what y'all are talking about. Should I include alien abduction in my medical history? If it's an alien, or if you're an alien, or if you got like, a satellite coming out of your backside like Cartman does off South Park, but whatever. Do you. Do they have LPN programs online? I know somebody did say that there is LPN programs online. You just have to look. I can't remember exactly where. Yeah, bro, I'm 55, Gen X representing. Stop it. I still don't believe you that you're 55. Get out of here. Livy said, do you know if case management is acceptable clinical experience to work with provisional license? That would be a Nurse Nelly question. There it is. She answered it. I'm from New York. All the nursing programs have long waiting lists here. Okay, Miss Supreme. Well, maybe you should think about possibly relocating to go to a school. So here's the question. How bad do you want to go to school? I don't know why I just clapped like that. How about how bad you want to go to school? You see what I'm saying? Like, are you willing to temporarily relocate so you can go to school? That's all I ask. I have so many people that were just like, it's been my dream. I was like, okay, make your dream a reality. Why I don't want to move? Well, I guess you don't want to be a nurse then. I guess you're just going to want to sit here and wait for something to open up rather than you going to go get it, even though it's somewhere else. Think about that. New Adrian RN BSN. Okay, Adrian, you got to come in here with your RN and your BSN because you're cool and shit. No, I'm just playing. Welcome, Adrian. Shout out to you. Oh, you're going to be an FNP. All right, cool. Shout out to you, family nurse practitioner. Okay. I'm 45 from Florida and I want to go to nursing school, but I don't know where to start. Well, is it Grand Mere seasonings and spices? Well, I guess you come to the right place. So the first thing is I always ask people, why do you want to be a nurse? That's the first question I always get asked. And that's the first question. That was the first question I got asked when I said I wanted to be a nurse. I said it out loud. And so I ask everybody else, why do you want to be a nurse? What is your why? Tell me why. Looking at schools that doesn't require HESI or TEAS and BSN programs at $60K. I'll use my GI Bill option. So you can use your GI Bill for you to go to school. Yeah. And then also if it's a high enough program or if it's a private school, you can look into the Yellow Ribbon program. You can look at all that if you're using, you can look at the VA and they have all that stuff. Or most of the time on the school's website, they'll tell you that they're, recipients of the Yellow Ribbon program. Also look at the VRE on the VA too. Bliss said I'm L&D, Alaska, 24 years. 24 years of what? You're 24 years old or you're 24 years as an L&D nurse? Check out the medical corps. Yeah. Underserved areas. There it is. Underserved areas. I'm a sophomore student working towards my BSN at Rutgers. Shout out to you. Advice on specific fields to look at. Well, Michael O'Connor, it all just depends on what you want to do. What type of person are you? Do you want to work with babies? So you want to work in labor and delivery? Do you want to work in the emergency room where shit can get real? Do you want to work in the ICU where shit can get also real? Do you want to work in the OR? Do you want to work in PACU? Do you want to do flight? Do you want to be in the military as a nurse? What branch of service do you want, or what branch do you want to go to? Because each branch has a different mission, even though we all relatively do the same thing. Do you want to do case management? Do you want to be a wound ostomy nurse? Diabetic educator? Do you want to be a nurse educator? Do you want to be a family nurse practitioner? So you got to sit there and think to yourself like what you want to do. Sadiki said, go to private college. Why would anybody go to private college when you can get the same education somewhere else? Now, if the private college was all that you had, then cool, go there. But you You don't have to go to public college if you don't want to. Alaska has a lot of scholarships. I did hear that. I had a friend, she went to school. We went to school together here in Texas, and then she went up there because her husband got stationed up there, and she went to some nursing school up there in Alaska. So I didn't know that about the scholarships. Let us know about all those scholarships Alaska got, though, Bliss. Is it worthwhile as an admin to go to school online? I've been debating it hard lately. I don't know what that means. I need for you to read. Like, either I read that wrong or you wrote it wrong. I'm just going to assume that you wrote it wrong, so rewrite it. Should I pursue LVN first to make money quicker? What do you think? Well, is it Kat? I'm going to say Kate. Well, Kate, that is an option. You could go to LVN school to at least get your foot in the door or get your feet wet to understand the aspects of nursing. You could for sure do that. I can't really tell you because I don't know what your financial situation is. I'm not there with you. I don't know how you live, and I don't know what your daily life dynamic is. So the question is, do you feel like that's feasible for you? But remember, it doesn't matter where you start. Essentially, it's how you finish. So you can go LVN, then go ASN RN, and then go BSN RN, and then go get... I've known people that were damn janitors. I know a girl who did photography and then went to CNA. She's like photography, CNA, LVN, 2-year RN, 4-year RN, and blah, blah, blah. I mean, everybody's journey is different. Although relatively the same, everybody's journey is different. So it all just depends on what you want to do. KB says, still debating on getting my degree. I don't have the money for it. Well, if you don't have the money for it, here, so I'm going to ask you, this is not just for KB, but this is just for anybody. I'm like 22 messages behind, so I always got something I'm going to talk about. But this is what a lot of people say, this is something that I also tell people, like when I'm coaching them, and I was just like, okay, so you want to do this. You want to pass your exam. And I was just like, but you were unsuccessful at your exam. Now, let me ask you this. What would you do if your car broke down? They'd be like, oh, I would have to get it fixed because it's my means to me doing what I need to do. And I was like, you would constitute that as an emergency, right? They'd be like, yeah. And I was like, okay, so you went to school for 4 years and you went to school to do all this and do all this, but now you failed the NCLEX. And you're like, yeah. And now you failed the NCLEX again. Like, yeah. And I'm like, okay, so wouldn't this constitute as an emergency? Because you invested all this money into that. So it's just like, okay, so now what are you doing wrong? Like, you're not a mechanic, right? So you're not going to fix your car. So if there's something that you're not understanding, do you want to utilize some type of program that can help you, get from point A to point B the fastest way possible? So when you're like, I don't have the money, I was like, okay, do you want to go to get your degree? Do you constitute getting this degree as an emergency? If you do, you'll find the money. If you don't, then, you take your time. I'm just saying. And remember, you don't need a degree to be successful in the world. Like those days of the brainwashing of getting a degree and all this other nonsense are over, right? Shout out to TikTok and all social media to bringing that to light, right? Don't do it. Yes, I'm willing to relocate temporarily. I just need to establish a job to where I will locate to. That takes the logistics and that takes planning, and you can definitely do it. I want to be a nurse. I want to be a nurse because I'm poor. A lot of us nurses are poor. I'm just keeping it real. So what's the difference between the scope of practice between an RN and an NP? Well, an NP is an advanced practice nurse, so they can prescribe medications. They can make medical diagnosis. RNs cannot do that. 24 years. Oh, okay. I got you, Bliss. I got you. I know I'm late. I'm catching up. Bulky said, hi, I'm still in nursing school. Just a few months left. Any tips at this time? Well, you say you got a few months left. I want to say about 3 months before you graduate, I would start looking into an NCLEX program or start looking into studying for your NCLEX and repetition, doing questions, answers, reading your rationales, looking at content, recreating the testing center, get into that mode of taking that exam. Because if you get into the mode taking the exam now, by the time you take the exam, it's going to feel so familiar, you won't have any anxiety for it. KB said, should I start with a medical assistant certification? You can start there if that's what you feel. Does the boot nurse imply military? Genuine question. Is it Mora? So it actually implies, it originates, the boot nurse aspect originates from the term boot. That's what we call each other when we first join the military. It doesn't matter the branch of service. And a boot is somebody, obviously you're going through boot camp, but the term is like, hey, you don't know anything about anything and you learn as you go. So it took me a while to kind of figure out that name, and then that's the one that just kind of stuck. And then, of course, sometimes I represent my military aspect on here. And, one of the most significant things that sticks out when we're talking about, military stuff are boots. So, the military individuals get it. And then now civilian individuals will be like, oh, he wears boots and I've seen those, so he must be in the military type deal. So it kind of is like a double entendre, maybe. I don't know, but you get it. But that's where it originates from. Can I do travel? Can I do travel nursing in Hawaii? Yeah, Connor, you sure can. Hell, they need travel nurses over there right now. You know what's going on? Hey, but first of all, that's a very tragic thing that happened over there with all the fires that are happening in Hawaii. But you best believe that they need nurses that are over there to help take care of all those people that are over there. I'm in nursing school right now, LVN to BSN. Shout out to you. What route did I take? I was in the military. Well, I joined the military, did the corpsman route. So I've been doing medicine since 2007. Wow, I feel really old saying that, but I've been doing medicine since 2007. Became a surgical tech in 2010. And then I started my nursing school journey after my second deployment to Afghanistan. And so I want to say my journey started in 2013. Got my prerequisites done 2016. Started nursing school 2017, graduated in 2018, got my license in 2020. So it was a nice journey for me. I could sit here and talk to y'all all about that. But if you guys want to know a little bit more about the journey, go over to my YouTube channel and go all the way back down to the beginning in 2020. And you'll see all those nice, great, glorious videos where I'm not talking like this. I'm like all stiff and shit. So, well, that's the route that I took. I'm a nursing home admin. Okay. Is it worth to go get the BSN? I've been debating. Okay. So you don't have to go get your BSN. You can go get your ADN, or you can go get your, you want to go be an LVN or LPN. You could go do that. You can go do that as well. What do you think of using BSN degree to go to PA school in the future? No. If you want to go to PA school, go to PA school. Like, don't waste your time trying to get a bachelor's degree in nursing when you want to be a PA. This isn't anything on you, but I have so many people that are just like, hey, I'm going to go work as a nurse and I'm going to go PA. I was like, why don't you just go straight to PA school? Like, one thing is, don't be indecisive. You know what I mean? Tori says, I'm a senior in nursing school, hope to travel internationally in a few years. Tips to travel and practice. Okay, that's a good question. So there's a ton. Number one, get at least a year to 2 years of experience where you're working. This is for Tori. Get at least 2 years, 1 to 2 years. And there's so many websites out here for international travel. Like, you can go do freaking nursing in like Japan, Singapore, all throughout Asia, India. You can go to the UAE, where, like Dubai, Bahrain, Qatar. What else is out there? Kuwait, all those other places out there. You could do tons of nursing over there. And here's something that most people don't know, is that when you go over to the United Arab Emirates, or UAE as they call it, all that money's tax free. Just saying. Kate said, well, the money would be nice, quicker. So I am thinking, yes, thanks. Okay, got you. BSN is a waste of time. Depends, Steve. Depends. You have the money? Yeah. BSN is a waste of time. Yep. It says, come stay a year in Alaska. Apply for Alaska Pacific University for the most scholarships. Okay. Shout out to you. Let's see what else we got going on. Hey, so shout out to all 52 of y'all that are up in here. I got like 28 messages to catch up on. But hey, if you're new here, welcome. My name is Kevin. I go by the Boot Nurse. Shout out to all of my, I'm going to say admins, but all of my co-hosts that are down there. You got Sasha that's down there who will fight you. I've already established that because she stayed trying to fight me. And then we got Nurse Cass that's down there who is the bouncer of all of the co-hosts. And you got Nurse Nelly down there. So if I miss any questions about anything that you guys are asking, those individuals have no problem with answering those questions for me. Also got Nurse Adrian up in here, who's a plethora of knowledge. Apparently she's 55, but I don't believe any word that she says. Make sure y'all smash that like button because I'm tired of y'all. No, I'm just playing. I love y'all. Shout out to y'all. So, yeah, if you're new here, I want to know who you are, where you're from, what questions you have about nursing. It could be about prereqs, pre-nursing. It could be about nursing school. It could be about the NCLEX, which is what I talk about and which is where my passion's at, because I failed my NCLEX 3 times. Three times. And I have no shame in telling nobody in this chat or in this live that I failed my NCLEX 3 times. Want to know why? None of y'all would have ever known that. If you're new here, none of y'all would have ever known that unless I open my mouth to tell y'all that. Because it does not matter how many times you fail it. It just matters that you pass it and that you have a license. And so I have mine. So when I say that, let your failure be your fuel to success. Okay, it doesn't matter who you are. All right, think about that. So let me get back to you guys' questions. Let's see what's going on. Just got my RN license. Is it wise to go to phlebotomy school before residency starting in October? Wait, if you already have your license, you don't need to go to phlebotomy school at all. My wife, diploma nurse. I'm assuming what can she do? If she has her diploma as a nurse, she could work as a nurse. So, and if you're from India, so if you're from India and you're trying to work as a nurse in the United States, I'm not really too sure on how that converts. Her license would have to go through the state, wherever you move to, the state's board of nursing, and then they would have to give the equivalent. And then they would actually have to give you a thumbs up or a thumbs down on if it applies or not. Southern Belle said, thank you. You're welcome. Hi, RN with 19 years of experience here. Shout out to you, Chanel. Okay. Said only broke nurse I know don't know how to manage their careers. Hey, that's facts. If you don't have any type of financial literacy at all, like if you can come up here and start to tell me about what Kim Kardashian wears and all about that stupid ass show on Hulu, but you mean to tell me you don't know anything about financial literacy, I'm gonna need for you to get out my chat. I'm just keeping it real. Let's say a RN program or evening BSN program for a middle-aged married person. Once again, age has nothing to do with nothing. However, based off of your situation, you could have a family, married with children, understand. But it all just depends on you and what you can do for yourself. Okay. What branch? I am in the Navy and I am not a naval officer. I am an E6 in the Navy right now. But funny story, I did apply for a commissioning program or a commissioning package, and I should be hearing something back about that soon. So we'll see. Let's see what else is going on. It was a light. Excuse me. It says light. Just tuned in. I'm doing my prereqs for nursing right now. Just want to show some love. Shout out to you for showing some love. I appreciate you being here. Livy. It says what does it say? What SPA? What you talking about? What is PA? Okay. PA is physician's assistant. Is it Rosier says, are you a nurse? Yes, I'm a nurse. Or they can become an NP with a nursing degree. Yes, you can become a nurse practitioner with a nursing degree. Absolutely. My passion is NICU and to help nurses pivot from bedside to anything else. Gen X RN. Okay. So Gen X RN, are you like a nurse coach to try to help get nurses off of bedside to like non-traditional type jobs, like, like medical devices or insurance companies or pharmaceuticals or case management? Well, case management does take you from bedside, but you got case management, data utilization, talking about stuff like that. What's it? Rose James says matters that you passed is, yep, that's it. How many times did you take the NCLEX? I took the NCLEX 4 times, passed it on the 4th. Looking for nursing schools right now. Any recommendations? Currently living in Boston. I like Western Governors University. I will check them out. Is the next gen test harder? I can't really. To me, I think the next gen test. Okay, so there's not a lot of people that come onto the chat that are just like, hey, the new generation NCLEX is. It was fine to me, but they don't know what the old NCLEX looked like. So compared to what the old NCLEX was to the new NCLEX, I think the new one's better because you have more opportunities to pass it. So all the old questions that were on, or the old question formats that were on the old exam are still on the new exam. So you still have select all that apply. You still have multiple choice. You still have, your drag and drop. You still have, or your click and drop. You still have your put in order. You still have your click to where like, where's the suction control chamber type, stuff like that. But then they have the other ones like, your extended responses. Your highlights for in the paragraphs. They have case studies, which you can get 6 questions out of, so now they add those different ones and the scorings are different. So now you can get partial credit on certain questions. So to me, I think it's easier, but hindsight's 2020 because I have 3 years of experience now to where I'm just like, I can't even believe I got that wrong. You know what I mean? So Bubble Gang says, new RN here. I'm barely 2 months into my med surg position. And I feel miserable. Does it get better? Yes, it does get better. 100%. Because right now, Bubble, you feel like you have imposter syndrome. You feel like you don't belong there. You feel like you're not learning and you're not picking it up right, or you're not picking it up fast enough. It will come with time. I promise you, it will come with time. Be a sponge, absorb it, get into a routine. That's the biggest thing. Get into a routine. When you first come in and you get your, you get your report, you go to the most unstable person that you could find that you're taking care of, and then you go through your head. You do your head to toe assessment. You do all that stuff, right? Once you get into that routine, you'll be okay. But it'll get better. Kate's laughing. Rose is laughing. I don't even know what we're laughing about. I'm so far behind now. Hey, I used to work for the Navy. I still work for the Navy. Look at me. So it says, Ambu says, I'm reporting you. Sorry, but I'm reporting this live to TikTok corporate. Okay, I don't know what that means, but sure, do you, boo? I applied for a direct commission and hope to go ODS in October. Shout out to you. Hey, no, I would say maybe I'd see you, but you won't see me there. But I do know some people that are up there. I'm reporting you right now, but unacceptable. Okay, I don't know what that means. Hey, hold on, because that shit's kind of annoying. So, you know what I'm going to do? 600. There we go. It ain't even a 600. It's just a block, because that shit's annoying. Can you make me a mod, bro? Yeah, bro, I got you. Hold on. I don't even know how to do that. I don't TikTok well. I'm about to figure this out. I'll make you a mod. I got you. Gen X says, yes, nurse coaching and soon to be author. I help with mindset first, because that's what it means. That's all that matters. That's awesome. What made you pass the fourth time? I took a step back in regards to, I was just like, why did I fail? What am I doing wrong? And in reality, I got a mentor. And I got a mentor I didn't even know that I needed. It just naturally happened. And I talk about him all the time. He's retired lieutenant colonel in the Army, 15 years as an ICU nurse. He was a corpsman in the Navy. So we vibed right from the beginning. And he pretty much told me to my face in the most aggressive but loving way possible that I wasn't doing something right. And then he was like, he's right. And he was just like, what you've been doing has not been working. He was just like, so now we're going to do what I say. And I was just like, okay. So he was just like, if it's not working, you have to try something different to see if that works. And luckily for me, on the fourth time, I found a pattern that worked for me. I had to audit my time. I had to put myself on a schedule. I had to create a study calendar. I continued to cut people off. I recreated the testing center. All the things that I tell y'all is the same things that he essentially told me, so that's what helped me pass, and the determination and getting comfortable. When I went to go take my exam the fourth time, I ended up sitting like this, and I didn't even realize it. I got to question 40 or 45 before I realized that my hand was even there. And I was just like, all right, cool. I'm in a place of comfortability, because that's how I trained myself when I was studying. So if you get into that habit, you have a very good chance of being successful. Thanks. You're welcome. No problem. What's up, Stace? Welcome. Welcome. Let's see. How did you figure out what specialty you wanted to go to? Well, here's what I'll tell you is, for the longest time, I wanted to go to the ICU. You couldn't tell me nothing. You weren't sending me to med surg. You weren't sending me nowhere. If I didn't get ICU, I wasn't going to the hospital. I promise you. And so, because I wanted to be a CRNA, I've been wanting to do anesthesia ever since I learned about it. And then, I ended up getting into the ICU. Before that, I had an internship where essentially they got free labor out of me, but I got free training out of them, which was fine. And I worked in a burn ICU for 6 months. And that was on my way out the door from active duty. Fast forward to, August of 21, I started working in a medical and a neuro ICU. And that was during the second wave of COVID. So y'all can only imagine how that shit was, right? And I wanted to do ICU, but it was so chaotic to the point to where I was just like, I don't want to do this anymore. And it wasn't about the chaos about the patients, because that was expected. It was about the other stuff that was in the background. The terrible patient nurse ratios, the unsafe practices, things that were a lot of things that were unethical, and the lack of the support from the hospital as well as from management and administrators. Don't get me wrong, the manager that we had in the ICU, she was great. She did say one thing to me that I didn't like, and I confronted her about that. But other than that, she was always super great, and she tried to be supportive. But you can't really be as supportive as you think when all hell is breaking loose, because that's exactly what was happening. And so the great thing about nursing is that you can have the thought process of wanting to go somewhere and it not work out for you, and that's okay. Ask Nurse Nelly. Nurse Nelly worked in med-surg. She worked there for like 3 years. Then she went to ICU because she wanted to learn a critical care aspect. Was there for like, 6, 7, 8 months, and then dreaded it and hated it. She loved to learn what was going on in there, as in, learning about pressors and vents and CRT and, balloon pumps and, how to total manage a patient. Messing around with pressors and like playing like the up and down game, and you're just sitting there, or learning more about in depth for EKGs, learning about, like I said, learning about the total aspect of a patient. Like that stuff is great, but the environment of the ICU, at least now, I don't know how it's always been before I joined, but it just wasn't a conducive one for her, and that's fine. And it wasn't a conducive one for me. There were times where I went home and I was just like, bro, like, I did not like that at all. And it made me feel very uncomfortable. And here's the thing is that just like a nurse, if you have a gut intuition that something's going to happen, even not as a nurse, if you have a gut intuition that something's not right, you should probably kind of step back from it. And that's what I did. So I left, and then I went to the PACU, and I worked in the PACU. Loved it. It's great. I think all nurses, if you want to go there, go there, and then I ended up working in the OR. So, so I worked in essentially 3 spots within the last 3 years, and I'm okay with that. Because it's my license, it's my life, it's what I want to do. And I can tell you right now, don't ever let anybody put you in a position to put your license at jeopardy, because you're the one who fucking worked for it. Because trust me, there are people that are out here that will throw you under the bus to save their own ass and their own license, because they don't give a fuck about yours. I'm just keeping it all the way real. Shout out to all 51 of y'all in here. Thanks for listening to me go on to my rant. I appreciate all you guys' questions. Make sure you guys are sharing this live. Make sure you guys are smashing that like button. I want 100,000 likes. Look, if you can give somebody who's going to be an NPC on here doing all this nonsense, and they can look, hey, help your boy out, make it happen. All right. But like I said, I'm Kevin. I go by the Boot Nurse on all those social media platforms. But enough about me. I want to know about you. Are you new here? Tell me about your journey. What type of nurse do you want to be? Like, where are you in your journey? I want to know all that stuff. I'm trying to foster a great, community and communication down here in the chat. Got a bunch of people that are down there. They'll hook you up. So I'm going to keep answering you guys' questions. Let's see what's going on. You validated all of my feelings. Thank you, Bubba. I'm trying to tell you, I got you because I understand how it feels. User, yeah, just blocked them. Oh, I already blocked them. We're good. Blocked. Hey, if y'all want to block them, y'all can block them too. Blocked. That's what I'm talking about. What else? That's awesome. Congrats. Thanks for your time. Of course. Same. I want to do the ICU, either cardiac or NICU. Is it Kanya or Chania? If you want to go, go. Don't let them stop you. Is it worth it to get the RN, LPN right now? It depends on you. Do you want to go back to school? I can tell you right now, there's one guy that I coached, help him pass his NCLEX, his LPN NCLEX or his PN NCLEX, and he passed on his first time. He makes more money than I do. He makes more money than me. I'm just keeping it all the way. He makes more money than me right now. You see what I'm saying? There are you can make well over $100,000 as an LPN if you know the right directions to take. Because you can be a travel LPN. You know what I'm saying? You can do all those things. So is it worth it for you to become an RN? What do you want to do? What is your end goal? Do you want to be an MP? Do you want to be a CRNA? Do you want to be a nurse educator? Do you want to, be a director at some point to, go work in a hospital? Like, what do you want to do? It's not about me. It's about you. Remember, I have my license. I have my RN. That's what I wanted for myself. I didn't want to really go back to school to get my master's, but I'm just like, I want to be a nurse. I want to continue to educate, and I want to broaden my education horizon. So I got to go back to school, right? So it all just depends on you, Stace, on what you want to do. Toxic workers and management facts. What does it says? Kari, I'm in my last year of nursing school. 10 more months. Shout out to you. Hey, those 10 months are going to fly. They're going to fly. But I thought I wanted to be an ICU nurse, but now I'm doing home health. Yep. And you're loving your life. That's what I'm talking about. You got to keep an open mind during clinicals to experience every specialty to find where it fits best. Yep. Because when I was in clinicals, I already knew. When I was in ICU, I was like, yep, this is what I want. But I went to a level 1 trauma facility. So that's another thing, too. If you're a brand new nurse, my recommendation is that if there is a level 1 trauma facility near you, go there. The pay may be a little bit less, but the experience will be a lot better rather than you going to a level 3 regional or anything like that. I think he's back. Hold on. Sir. Hey. Hey. What? What are you doing? All right, I don't know what he's doing. I don't know what he's doing. Shout out to the other co-host. Wow, I was also looking into the OR as a first RN. You could do that too. Preach. Yep. And there goes Cass. Got to have her own backs. Facts. I'm new. Rosa, I'm new. Close to retirement. Okay. Hey, that retirement can't come no closer, right? Can you specialize as an RN? Kate, of course you can. You can So here's the great thing about being an RN is that depending on where you are, you can specialize. Like there's so many different specialties. I can't even name them. If you ever go, okay, I want everybody to take the time to go to nurse.org and then look under their certifications. There's like 200 different certifications you can get as an RN. Like you can specialize in doing like lactation, like mother baby lactation, like showing moms how to breastfeed. And that's it. You know, like you can get down to the nitty gritty. Stacy, I've been an LPN for 25 years and my last day of RN school is tomorrow. I'm so excited. Shout out to you, Stacy. Shout out to you for being, first of all, being an LPN for 25 years and now you want to be an RN? That's what I'm talking about. Hey, nephew. Yeah, you know he back here screaming. He gone now. Oh, yeah, I wanted to be a lactation nurse too. Can I teach as an LPN? Stace, what do you mean? In what capacity? If you mean what do you mean? Can you teach as an LPN? Like, can you go to like a university and teach? Or not a university. Can you go back to your school and teach or anything like that? So if you want to do like formal teaching, you're welcome, Stacy. If you want to do like formal teaching, like at school, as an LPN, no. So you usually have to have like that degree higher to teach the degree lower. So like to teach BSNs, you have to have at least a master's degree. If you want to teach, if you have a bachelor's degree, they usually only let you teach, the LPN or LVN program. So a master's degree in education, BSN RN. Is that oncology? Oncology nurse, you're certified? Love it. Hey, I can tell you right now, going to MedOnc, I don't know what it is about MedOnc, but I love the nurses that are up there. I love it. I love them up there. So shout out to all y'all. Hey, y'all, I finally caught up. Yeah, oncology. That's what I thought. Like, I finally caught up to all my chats. So, I got all 51 of y'all in here. I done answered almost all your questions. Almost all of them. You know how I go. So, hey, so today's Monday. What y'all getting into? How was y'all's weekend? Take a drink of water. All right, I'll take a drink of water. I got you. Hey, first of all, y'all see this? Look at it. You see them? Slytherin gang. Don't judge me, okay? Don't judge me. I got any Harry Potter fans up here? I'm just keeping it real. Samantha said, I have an interview tomorrow. Shout out to you, Samantha. What do you mean, wrong nose? Wrong hoe. What? Huh? Shout out to you for having an interview tomorrow. You're going to go out there and you're going to crush it. My teenager actually hung out with me this weekend. Okay. All right. I'm guessing that's just like not a norm thing. You'd be like, oh my God, my baby ain't a baby no more, but they still love me. I take my NCLEX by the end of this week. So nervous. Well, I'd be nervous too. No, I'm just playing. I got you. You're nervous and it's okay for you to be nervous. But here's one thing I'm going to tell you is how have you been practicing for your NCLEX? See what I'm saying? She's 16. I'm not cool anymore. Yeah, we never are. We never are when they're teenagers. They're just like, go away. We're celebrating my eldest birthday this weekend. Okay, shout out to the birthdays. I don't know about celebrating nobody's birthday because it's hot. Too hot out here for all this nonsense. You practice Kaplan questions and listen to Mark Clement. That's cool. That's the same combination that I used. I used Kaplan. Although Kaplan is probably like on the premium side when it comes to NCLEX preps. But Mark K, look, so here's a great thing about Mark Clement. Those audios were recorded like anywhere between like 2008 and 2010. You see what I'm saying? So not a lot of that stuff, but some of that stuff is obsolete, but it is literally still like 90 to 95% relevant. Like an example, let me see if I can remember. Like he says something about like when you have a patient that has a ventricular like dysrhythmia, they used to use lidocaine, but now it's amiodarone, right? So in his audio, he talks about that. And now they don't use lidocaine for anything ventricular. It's all amiodarone, right? Or where he talks about how to understand ventricular versus atrial EKG readings. Like it's great. Like I love his stuff. I love it. Every so often I'm sitting here and I'm just like, man, what was that? And I go and I'll be like, oh yeah, I remember it. Gotta go. It was nice chatting with y'all. Have a great evening. With Adriana, have a good evening. Thanks for stopping by. Make sure you let everybody know that we do this every Monday, Wednesday, and Friday. I use Kaplan and Hearst. That combo gave me the content and test taking strategies. Look, I couldn't do Hearst. Look, because Aunt Marlene, my aunt, and that country ass accent is too country for me. Granted, she kind of reminded me of that one lady off The Blind Side. I don't know. It's Aunt Marlene, y'all. I hope she never sees this. Don't y'all share that with her. Okay, don't do that to me. Shout out to all y'all. I use Mark K in the NCSBN. Yep, and that's another thing that I tell people too. They was like, hey, what do you think I should get to study the NCLEX? I was like, well, the NCSBN, they're the ones that write the test. They provide it. You can go use them. Just saying. What is that? Thanks for that. It helped with my confidence. You're welcome. User 858875616531. Oh my goodness. But hey, shout out to all 54, well, now 53. Oh, well, now 54 of y'all. If you're new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. I do these plugs every 10 or so minutes to kind of help break it up. And because some people are just like, what the hell is this dude talking about? Well, of course, I love myself, so I like to talk about myself. Okay. Anyways, I go by the Boot Nurse on all social media platforms. If you guys go to my doppelganger, Justin Derulo, you'll also see my picture on his Instagram. I'm just kidding. Don't do that either. Don't any of y'all try to tag him either, because he can be like, bro, we don't look nothing alike. But I'm just playing. I get that all the time. They say like, you look like Jason Derulo, and I'm just like, technically he looks like me because he looks like me because I'm older than him. But whatever. So yeah, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Pre-nursing, nursing student, already a nurse, NCLEX. What different types of nursing jobs do y'all have out there? I know that Nurse Adrian, she does something with legal. I know she said it to me earlier. I don't know. I already forgot. I'm just keeping it all the way real. Like Nurse Nelly, I know she does case management. Me, I'm an OR nurse. We got some other folks in here like Nurse Cass, who does corrections and does psych. And she has certified UFC hands, and she'll fight you. I'm just saying, you got Sasha that does peds and that does OR. So what do y'all do down there? Like, y'all let me know down in the comments. We're trying to keep that conversation rolling. I just didn't know if I was using the right thing to study, but now I'm in the right track. So here's the thing is you may not know what the right thing is until you purchase it, but then again, a lot of those reviews have the testimonies to prove that their stuff works. In the end, it's all about you and how you study and how you retain information. Okay. Just failed the NCLEX RN using Archer. Any tips? Okay, Mario, I'm going to ask you, why did you fail? Okay. Like, do you not have an understanding of content? Do you not understand NCLEX style questions? What is your time management like? Did you have a study plan? Did you have distractions while you were trying to study? Did you recreate the testing center? I really like to say support system, but do you have a support system? If you don't, you got one now. Welcome to the chat. You see what I'm saying? So you got to think about all those different things, right? It's like, hey, I just failed. And let's reword it. I just failed the NCLEX RN using Archer. Archer has been proven to work. So my question is, what did you not do? And I like to call that like a personal audit, right? Or as I say, time management is life management. So what was your life like? How did you study? How did you not study? Did you have accountability? Stuff like that. So if you care to tell us, let us know. We're all about being honest. Be honest and upfront, because if you can do that, then that's how you know that you can fix yourself. Because the only person that's going to fix you is you. Is that Margaret says an LPN? Okay. Any idea for schools in North Carolina don't want to go to the big university? You can look at any community college. Matilda, hey, that's one of my favorite movies of all time. Oh my God. I'm sorry, I couldn't help myself. But you have a very famous name, Matilda. But hi. For Stace, you can look at any community schools. They have online programs. And the one that I will always recommend to anybody is Western Governors University, because it's all online. Except for certain things like within the nursing program that has to do with clinicals and stuff like that. Every time you're live, Aubrey says, Mom, Jason Derulo's live. Oh my God, here we go. PACU nurse. Hey, shout out to me. Hey, I loved when I was in the PACU. Loved it. It was great. About to take my MP board. Shout out to you, Samantha. Okay. What type of MP do you want to be, Samantha? Let everybody know. Roseflower says, hi, fourth and final year of nursing student. Latoya, shout out to you. That'll come here before you know it. User 26, nursing student, medical surgical intermediate. What does that mean? Like you work in med surg? Like not a step down, but like under a step down? Is it Sarmila? I think I said that right. Matilda said, I'm a nursing student. Well, okay, I got you. I'm tracking. Famous name and a nursing student. Got you. Yes, we're your support system and your family now. Facts. Margaret said, I just filled 2 for LPN I used. Okay. You're welcome, Matilda. Somebody got blocked, so I don't know what y'all said. Oh, okay. Sarmila. Man, I said that right. Okay. Surgical oncology MP. Shout out to you. Okay. I get this job tomorrow. Okay. That's what I'm talking about. Like MedSurg. Okay, I got you. I'm tracking. I got you. Look, I ain't never done anything lower. I ain't gonna say lower, but like, I guess in acuity, it was either ICU, well, PACU, and then OR. So I guess, it's kind of like a little bit of few in between, but it's just the way that the patients flow. So I just wanted to make sure. Surgical oncology. Okay. All right. You're going to go work with a group? You're going to go work with a group, Samantha? Hey, shout out to everybody just smashing that like button. Make sure I get the 10,000 likes or I'm sending casts after you. I appreciate it. Love you. Anyways, so yeah. Are you going to go work at a group or anything like that? Yeah, it's like Metro step down. Okay, I'm tracking. I got you. I don't know where our co-host went. The other one that wants to stand outside the door and put his little grummy little fingers under there. You know what I'm saying? So, a lot of things, another bunch of things that I like to talk about is nursing news. One of my favorite websites is nurse.org, where I like to find all of my nursing news, as well as I follow them on Instagram and on TikTok. Another good one to follow is Nurse Alice. If you guys don't follow Nurse Alice, what are y'all doing with y'all life? Nurse Alice is I'm not sure if she still is, but she at least was an MSNBC medical correspondent out in the California area. I want to say it was the LA or San Diego area, but wealth of knowledge. She's an FMP as well. And she has a podcast as well, which is actually pretty good. I'm actually trying to get on it. I'm gonna need for y'all to help me get on it. I'm gonna need for y'all to like spam her and be like, hey, yo, get Kevin on there. He got something to say. You know what I'm saying? He got something to talk about. You know what I mean? So I was in a community nursing school and was almost done, but failed OB and peds. OB and peds can be tough. You want to know why? It's because you're dealing with 2 patients at the same time. Right? So mom has her stuff, baby has baby stuff, right? So the one thing I'll tell you, Matilda, is that is an area that you would want to dedicate a little bit more time to. I know that sounds very cliche, but that is the honest to God truth. Yes, it's the clinic at my university hospital. Look, you about to go work at a clinic and you about to now you're really about to love life. You ain't got to be working about bed. You ain't got to be worrying about no bedside. You ain't got to be worrying about look, you know what? I'm happy for you. Hey, Samantha, look, you got it going on. That's what I'm talking about. And they wouldn't let me back right away, so I switched to Chamberlain, and I wish I knew Chamberlain. So a lot of people didn't know about Chamberlain. A lot of people don't know about Western Governors University. If you live in Texas, you can go to Texas A&M in Corpus Christi. You can go to Texas Tech. They have an online an accelerated BSN program that's 12 months. You can look at University of Texas in Arlington. They have so many damn schools now that are online. Like, it's ridiculous. You just got to find them. What is Nurse Alice? It's Ask Nurse Alice. That's what it is. Nelly. Before. Okay. Hi. You're from Jersey? Ew. Wait a minute. You're in Jersey. So guess what's going on in New Jersey right now? Who can guess what's going on in New Jersey right now? I made a video about it and a lot of people didn't like me for it. So I made another one after that. You want to know why? Because I'm petty. There's a strike in New Jersey. Right. Yes, because I'm petty. And I'm going to say the same exact thing that I said on the last TikTok live that I did on on Friday, right? I 100% understand why they are striking. I do. I'm not one of those people like, oh shit, they're striking? They're striking? Fuck them. I'm just going to go over there and get this money, right? But I understand why they're striking. They strike for better wages, better benefits, safe patient nurse ratios, support, better all that. Those last 2 or 3, those are the most important. Pay is great, benefits are great, but I'm telling you right now, being put in unsafe situations as a nurse in all aspects of nursing is unacceptable, right? So I understand why they are striking. However, who's going to take care of those patients, right? And I hear so many people say, well, let us stand. Well, like stand with us. I was like, bro, I don't have a problem. I understand why you're doing it. I do. But the $120 an hour to work in the operating room for what I have going on personally, I don't have anything going on personally like that, but $120 an hour for someone else could help them. And you got to also realize strikes, especially like nursing strikes with that kind of money, they don't sustain for a long time. I personally have never seen, actually I should probably research that before I say it. Fuck it, I'm gonna say it anyway. I personally have never seen a nursing strike go longer than a year. And you got to think, it's just like to pay a nurse $120 an hour for a year. Somebody coming up out that money, right? And at some point, the hospital's they're gonna feel that. You see what I'm saying? They're gonna feel that. So I understand both sides of why people would go to a strike, so they could go make them $40,000 in a month. But I also understand why the people that live there want to have the strike. You know what I mean? Like, I like to think of myself, if you want to get on a political level, I'd like to think of myself as an independent. I'm not a Democrat. I'm not a Republican. I'm an independent because I can think for myself. I don't have to be on one side of the picket line. You don't have to. Because guess what? People that are, the strikes going on right now, I can guarantee you there's those people that are crossing the picket line so they can go work, so they can take care of their family. Y'all see what I'm saying? Like, bro, make it make sense. Make it make sense. Anyways, shout out to all 48 of y'all listening to me go off on a rant. But anyways, the strike is there. Money is there. If you want to do it, cool. If you don't, that is also cool. You don't have to, but it's there. That's just like saying, hey, no, I'm not going to say that. That's a bad analogy. But then there's also other opportunities out there, like crisis assignments, like what's happening in Hawaii, right? That's a crisis. These hurricanes that are about to tear parts of this fucking country up, what you think going to happen after that? What do y'all think is going to happen after that? Who they calling? FEMA, Crucial, U.S. Nursing, or whoever else. Hey, we need nurses now. We're going to pay you $200 an hour because this hurricane done tore this bitch up and we ain't got no nurses. What you think going to happen? Just saying. Nelly says, I mean, I could use $125 for these 4 damn kids. Look, I'm just saying, everybody's situation is different. I just applied for a strike assignment. Look at you. Because now, Barbie, you about to go out there and do what you need to do. You know, you're going to do what you need to do. Work them long hours. You know, benefit at the end. And then go on about your business. And ain't nobody going to come after you and be like, hey, I saw you. I saw you at the strike. Why ain't you fucking boycott with us? Because they was paying me $120 an hour. You know what I'm saying? You know what I mean? So, hey, like I said, everybody's situation is different, and however you decide that you want to go, do you. You're not physically hurting anybody, you know? And in the end, regardless of however people feel, it's like somebody has to take care of those patients. So if it's not going to be the ones that are going to be on strike, they're just going to bring in people to do what they need to do. So, and I'll tell them now, see them, Benny's by. What? Another nurse I know said she couldn't do it because it was against her morals. Well, that's cool. And that's her. And Barbie, that is most definitely her choice. It is against her morals. She doesn't have to do it. But other people's morals are very different. You know, strikes, crisis assignments, same thing. I mean, the strikes are very definite, but crisis assignments can be interchangeable. I'm taking it. Take it, girl, and make sure you sign. Hey, go ahead. Hey, you can definitely when you do, you know, finish I mean, whatever little diamonds or whatever, like roses or whatever they got on here, just, just like slide me like at least like 10 G's. No, I'm just playing. Oh, man. Hey, shout out to all 40 of y'all that are still in here listening to me run my mouth. Hey, if y'all got any questions, comments, concerns about anything, make sure you guys drop them down in the comments. We're trying to foster that good community. Also, check out the Boot Nation Facebook page. It's just like it is. It's just Boot Nation. You'll see, you won't see my wonderful face, but it'll say Boot Nation on it. And that's just the community that not only has the people that are in the 7-day NCLEX course, but, those nursing students, pre-nursing students and nurses alike that we're trying to foster a good community in. Okay. So, make sure you guys check that out as well. And of course, if you're a brand new nursing student that's about to start school, like today or next week or next month, check out the 7-day NCLEX course. Get it for $48 as it's being built. You get it forever. So by the time you take your NCLEX, you're going to have a full-fledged NCLEX course by yours truly and some other folks that are going to be in there with me as well. So I want to know who you are. There's 44 of y'all. So I know not all 44 of y'all are going to come up in here and be like, oh my God, Kevin, I did this, and I want to do this. So I need all 44 of y'all to come up in here. I need for you to tell me who you are, where you're from, where you're at in your nursing journey. Because I want to know. I want to know. Oh my gosh, I'm here. Did I miss the NCLEX review questions? You know what, Thunder? You're about to be mad at me because I've been thinking about it for the last 2 days and I wrote them down, but I didn't put them in the PowerPoint that I wanted to do them. And so I didn't do them. I mean, I have them I have them like on a Word document, but they're not like on a PowerPoint. And I'm all about presentation. So I don't have them. And I'm sorry. Wednesday, you got it. We'll do it Wednesday. Well, I got it here. Look, your boy just got a lot of look. You see that right there? You see that board? You see it? Those are fans, by the way. That's a green screen. Don't worry about that. But this right here, these are fans that I got to put up here somewhere. That's a sign, and that's my son. He's like, literally, he's holding my finger. I want to say he was like maybe less than a month old when we took that picture. Anyways, so that's what's over there. Your boy got a lot of things going on. I don't be forgetting, but I'll be forgetting, not on purpose. But I'm going to make it happen. I promise you I'm going to make it happen. All right. What's your worst experience with patient family? Ooh, that's a good question. There are so many. Oh, you want to? Okay. I got a good question. I mean, I got a good one for a patient family member. There was a guy that came in. I was taking care of a patient in the ICU, and we were essentially kind of giving an update. And what was going on is one of the family members came in there, and he pretty much was just like, "No, you guys aren't doing that. You guys are a bunch of liars." And me and the other guy are just like, "No, like we just got on." And this is what was given to us in a report, and we're still doing our assessment, and we're trying to make sure everything is good to go. No, that's what they said yesterday, and they didn't do that. Effing this, that, and the third, blah, blah, blah. I'm a lawyer, and I can sue the fuck out of all y'all. And I'm just like, oh, he ain't talking. He talking to me. And so then I have to realize that I'm not 18-year-old Kevin anymore. And I have to just be like, okay, like who is he talking to? And there was another dude that I was with. His name was Chance. And I used to say, like, anytime somebody would be like, say his name, they'd be like, Chance. And I'd be like, the rapper? It was just like a reflex. But anyways, that's the worst experience I had, is that this dude was talking about he was going to sue and do all this. And then he started to try to like walk up on me and Chance. And then I started to notice that Chance started kind of like backing up, taking shit out of his pocket. And I know that's the unit. And Chance he's a black guy. He's a black guy, a little bit taller than me. And so I know the universal sign of where you about to get your ass whooped. And that is exactly what was about to happen to this family member. So I was just like, no, we good. And then he's like, no, let me go. And I was just like, no, sir. And then I was like, hey, I got it. So I had to be diplomatic. I've been to a lot of counseling, y'all. I'm just saying, I had to be diplomatic. And so essentially I took it out of my hands. I grabbed charge nurse and I was like, hey, I'm gonna need for you to handle that because nope. Like how Shannon did? Nope. wasn't dealing with that guy at all. So that's honestly probably the worst one when it comes to like family encounters. But then I've also experienced encounters to where, some family members are just very oblivious to what's really happening. But I can say for me personally, I've had more good family encounters than I have bad. It says cookies and milk. I was about to say cookies and cream. Sorry. I took my NCLEX 4 times in 2008 and I didn't pass. I know I want to be a nurse. Is it too late for me? No, it's not. It's not. It's not too late at all. I failed my NCLEX 3 times, passed it on the 4th. So my question, cookies and milk. I'm lactose intolerant, so I don't drink milk like that. So my question to you is, you want to be a nurse. Is it too late? No. But what are you going to do about it? What are you going to do about it? Thunder says, OMG, I'm here. Okay, we already talked about that. Thunder, I got you. Wednesday, I don't know how I ended up all the way back up there. LPN from North Carolina, started my BSN program in October. Shout out to you, lady swag. Jaggy RN, hospice nurse in Florida. Shout out to all the hospice nurses. I have a couple of friends of mine that are hospice nurses, balling out of control, but of course taking care of those people in their last stages of their life. So yeah, shout out to you. I understand busy. I'm just logging in. Yeah, I got you. Callie said I'm 34 from Callie from California. I got you. Starting LVN school with the goal of being a CRNA. Okay, cool. LVN, RN, and then apply for LVN, RN, critical care. So you got to go to ICU. All these CRNA programs want to see ICU. That's what they want to see. All right. What is your 7-day NCLEX course package? Meaning, what does it cover? So, Jackie, right now, it is going through, I'm uploading videos that are really, really content heavy. But at the request and all the feedback from my students that are already in the program right now, I am putting a pause to a lot of the content based things that I'm putting up there, and I'm strictly focusing on the NCLEX style questions, like how to answer them, how to be familiar with them, as well as going through the 8 categories of the NCLEX pie. So management of care, pharmacology, physiological adaptation, reduction in risk, basic care and comfort, so on and so forth. So that is what I'm focusing on right now. And also it's in its pre-launch phase. I'm saying that again, it's in its pre-launch phase. So it is not currently finished. It is an ongoing program, but it's $48. So can you imagine what it's going to be when it's completely finished? I just like to put that out there. But get it. Once you get it forever. So you want to come over there and grow with us? Come grow with us. I'm all about it. And there are going to be other things that are going to be added into the program that I don't do, obviously, on TikTok. Like, I don't go through lectures on TikTok. I go through Q&A with the students, and that's see that list back there? That's part of that list. A lot of things are happening, and a lot of people are being included in that. So that's what that program consists of. So thank you for asking, and hope to see you there. I have to remember I'm not Colleen Vanessa anymore. Look, okay? Yeah, we don't need you being Colleen Vanessa no more. I'm 42 from SoCal, applied nursing program in February, got invited to take T's, pass, start next week. That's what I'm talking about, Leslie. That's what I'm talking about. I'm from New York. Brooklyn. I don't know nothing about New York. I'm sorry. Let me stop. I'm from Texas and Texas boy through and through. I'm sorry. We'll be continuing my prerequisites for the RN program Tuesday. Any advice? Get through them. And you want to strive to get A's. A's you want to get, B's are okay, C's are not. However, and I do say however, I have seen people get into nursing school with C's. However, you want to try to take away any notion for these nursing schools to be like, oh no, we don't want to pick them. You see what I'm saying? Like, you want to take that away. You don't even want to give them that option. Okay. And here's another thing for people that are taking prerequisites. Volunteer with the USO. Volunteer with the Red Cross at the hospital, because you can actually get a letter from the Red Cross that shows that you were a volunteer. You can take that letter, submit it with your nursing application showing that, hey, I volunteered at a hospital, with my free time, helping take care of patients. Then they're just like, oh, this person went above and beyond. They didn't have to volunteer, but they did. So they used their free time. That's somebody that I want to be in my nursing program. And nursing programs, when they look at your application, they're based off points. That letter right there could separate you from the next person getting into that program. So think about that. Sometimes you got to think outside the box. Okay. I took mine 3 times, lost my dream job. then reapplied. I start again next week. What do you took what 3 times? Carly, you took what? Your NCLEX 3 times? Is that what you said? Any test taking strategies? If you're talking about in my program, Jackie, I actually have a video that that's in my notes that I'm working on in regards to test taking strategies, like what words to look out for, like, understanding stable versus unstable, best versus first, easier ways to try to understand, select, all that apply. So I have those coming up as well. King, we're talking about nursing, NCLEX, and essentially anything that you want to ask in regards to nursing, or if you want to talk about, whatever. It all just depends on if I want to answer it or not. So how hard is nursing school? Nursing school is pretty hard. It will really test your time management, and it'll test your mental capacity to be able to understand nursing materials at a fast pace. It really will. I'm in school to get my 2-year nursing degree and then going for bachelor's and master's after that. Shout out to you for having that plan for yourself, King. Queen said, I'm going into cohort next fall. So like September-ish of 24. So cool. Shout out to you for that. Blair said, any advice on what to study for the entry TEAS exam or TEAS test? I can't seem to get the score, 5th time taking it. All right. So one, of course I say this all the time, but the Mometrics yellow book. If you study that Mometrics yellow book for a month straight, Blair, there should be no reason why you shouldn't do well on that TEAS exam. Okay. Queen said, thanks for the nuggets. You are very welcome, ma'am. Jackie said, yes, because that's a game changer for NCLEX. Facts. It is a game changer for NCLEX to know how to break the questions down. Put it this way. It's like I've taken the NCLEX so many times that I understand what they're going for. You know what I mean? So let's see. You're welcome, Blair. What's your opinion? What's your opinion on sickle cell? I mean, I don't know what that. I mean, you got to elaborate. You got to give me a little bit more information on that. You got to give me a little bit more info. So shout out to all 50 of y'all that are in here. Hey, I don't even know how long have we been in here? We've been on here almost an hour and a half, y'all. We almost been on here for an hour and a half, yo. So shout out to all 55 that are in here. Hey, there's 55 of y'all. I want to see 55 shares. I just share it just because. Just share it just because. If not, Nurse Cass may not be talking, but I promise you, she's gonna slide in all DMs with some fists and maybe knock you out. Maybe. I don't know. I don't think she's violent like that. I think she's just all talk, to be honest. Keep it all the way 100. So, there's that. Is it Laney? Laney. I've been a nurse now. I've been a nurse, now an MP for 17 years, and they haven't changed the damn test in decades. Well, they have changed the test now, but they haven't changed the content. It's just the way that it's delivered, because as of April 1st of this year, and no, it's not an April Fool's joke. No pun intended. The NCLEX did change, and only thing that changed was just the way that the questions are delivered. And I wouldn't even necessarily say it changed. It enhanced the way that questions are delivered. So still the same old question types are there. Your multiple choice, your select all that apply, your click and drag, your drag and drop, whatever you want to call them. And then they give you, a case study now. And now you can highlight to find the right answers. Now you can actually do, it's essentially like a fill in the blank, but the fill in the blank is a drop box. And you have to get both of them right in order to get the whole question right. You see what I'm saying? So the content didn't really necessarily change. And when the content does change, it changes like every 3 to 5 years. And it's like a 5 to 10% change. It's like very, very subtle. But the way that it's delivered changed drastically because they added those new delivery methods in there. Okay. Any tips for test anxiety? Mari, the best way to get through test anxiety is to practice. It is to practice by recreating the testing center. That is what it is. Practice by recreating the testing center. No drinks. No keys. I mean, I don't know why you would need your keys, but no keys, no phone, no nothing. Text people and be like, hey, bro, I can't talk to you right now because I'm studying for my exam or I'm doing a quiz. Go put your phone away. Take it out of the room. No browser, no nothing. They actually have apps where they will lock your browser for a specific amount of time so you don't even get on anything. So where it forces you to stay focused on taking your exam, right? So in order to get through test anxiety, you have to test your anxiety, if that makes sense. Like, you have to get through the anxiety of sitting here. And another thing I would say is always do your quizzes or your practice exams on the computer. Why? It's because your NCLEX is on the computer. Your NCLEX isn't on paper. Your NCLEX hasn't been on paper since, like, I don't know, like the 90s or something. Practice questions, so many questions. Yes, you do want to practice questions, but you need to make sure that you understand content in order to apply it to NCLEX style questions, right? So, wow, and I just joined. I don't know what that means. What does that mean? Arden, what does that mean? Yep, I cooked and ate dinner while you were online. Facts. Shout out to you. I've been a nurse since 1998. It's changed some. Yep. What's the best way of studying about clinical medical assistant state tests? I don't know. I've never taken a medical assistant test, so I can only assume whatever book that is out there that you can find on Amazon, to be completely honest. I've never taken a medical assistant, state test, so I really couldn't tell you. I would fail. Lainey, you would not fail. Stop playing. Case studies are easy. See, hindsight's 2020, so I'm saying that they're easy. 94, I think. Yeah, it was 1994 when the NCLEX changed from being paper to it being computer based. Most of y'all weren't even born. I was. How old was I? I was 4. I was 7. I was 7 years old then. Y'all do the math, okay? Y'all do the math. I do got a gray hair right here, though. It's hiding somewhere, and I got some ones right here. It's wild. I need a haircut. Shout out to y'all. Shout out to me. Your boy's going to get one at one point. We're going to figure my life out. So thank you. I appreciate all the information. You are welcome. I'm going to mess your name up. You know who I'm talking to. I'm just going to say thank you to you. And because I'm not going to butcher your name, but you're welcome. All right. Millie said she was 7. That's what I'm trying to say, man. That's what I'm trying to say. But 1994. So for the test anxiety, back to that. Recreate the testing center, and you have to practice, right? Practice every single time. It could be difficult when you have family, especially if you have little kids. Like, I have one that sticks his damn hands up under here. At one point, we were having a full-blown conversation. I was just like, it wasn't even my live stream anymore. It was his. I'm just like, you don't even pay no bills here, and you're just taking over everybody's stuff. You see what I'm saying? So what I'll say is you want to recreate the testing center, and you want to put yourself in those situations often. Because the more that you put yourself in those situations, the easier it will be when you go and take the real exam. If that makes sense. I hope that makes sense. Shout out to all 47 of y'all that are hanging out in the chat or that are hanging out with me, just period. If you guys are new here, welcome. My name is Kevin. I go by the Boot Nurse on all social media platforms. You guys see my little stole over here? Funny story about that. Didn't get it until a week after I graduated. But welcome to the chat. Welcome to this TikTok Live. I do these every Monday, Wednesday, and Friday. Make sure you guys go over there and follow me on Instagram, on YouTube, on Thread. Everything is at the Boot Nurse, except for the Facebook page, which is the Boot Nation. You guys can go over there and check that out as well. If you're a new nurse about to start school here within the week or the next 2 weeks, check out the 7-day NCLEX course. That link is in my bio. It's going for $48, which is 80% off its normal price currently. And once you get it for free. I mean, you get it for free. You already paid for it, but you get it forever until that changes. But if you get it now, you're going to have it forever, so it doesn't really matter. So I want to know who you are. I got 51 people in here. I want to know who you are. I want to know where you're from. I want to know where you are in your nursing journey. And I want to know what questions you have for myself or any of the other nurses that are hanging out in the chat. We got Nurse Nellie, who's been a nurse for 4 years, who's worked in a whole bunch of other spots, but she's a case manager, does case management now. I don't know where Adrian's at. Adrian is a plethora of knowledge. She's a 55-year-old woman who specifically told me she was 55, and I don't believe her. But she does she's like a concierge and does like legal stuff. Nurse Cass is down there somewhere. She's like a certified bouncer because she'll fight you, a.k.a. she does corrections and she works in psych. Got a bunch of other folks. Sasha will pop in out of here. She works in the OR and does peds. Got a whole bunch of folks that are down here that'll answer any questions that you guys have. So yeah, I want to know who you are, where you're from, and where you're at in your nursing journey. Pre-nursing student, nursing student, NCLEX, brand new nurse grad. Where are you? Talk to me. Let's foster a good conversation down here in this chat. And let's see where it goes. We've been on here for an hour and a half. We can see if we can go for another half an hour. Usually, I get held hostage. Because I say, hey, I'm going to go in like 5 minutes, and I end up being on here for like another 45. And then people would just be asking me questions at the end. And I'm just like, why didn't you ask me them questions like 25 minutes ago? Because obviously, they don't care that I have a family. I need to go spend time with them. Obviously, right? Obviously. So, where we at? What y'all got? Nurse Nelly, what'd you say? Whatever, I have 3 kids. One wasn't even 2. Shh, look. That ain't my fault. That is not my fault. Just saying. ATL, taking my human anatomy lab prerequisites this semester. Then taking pathology and anatomy part 2. I've always found that weird how they mix up anatomy and then physiology, and then they do, like, I've always found that weird. So, like, they'll split, like, some schools will split them up into separate classes just to make more money. When you can literally do anatomy and physiology in the same course. Like if you go to a community college and do it. But hey, everybody's different. I guess in the end, it doesn't really necessarily matter unless you, except for the fact that you get what you need to get for yourself. So I'm just saying. I think the next time I do a live, I think I'm going to invite people. So we'll do it like a live podcast, Q&A going back and forth type deal. So I think we might do that. Hey, smash that like button if y'all think we should do that. Or just even let me know down in the comments, hey, if you think we should do that. Like bring on somebody and then, we go back and forth and we talk about, like whatever. I may even bring on somebody that's just like, hey, like, tell us your nursing journey or ask your question, So we can kind of see where that goes. Hold that thought. I don't know why he's crying. He always crying about something. He's always crying about something. Yeah, I think it's anatomy and physiology. I don't know it's anatomy and physiology. 1 and 2. I got you. Do it. Hey, Nurse Nelly, I'm going to do it. 82, retired oncology head nurse, 40 years experience. Keep it up. Look, 40 years. I ain't even 40 yet. And just thinking about 40 years of just being like, look. Hey, shout out to you. Is it Johnny Jackson? Shout out to you for all those years of experience. Like that is wonderful right there. That's wonderful. But I'm aiming to get in a nursing program in spring of 2025. Okay. Always got those goals. Write them down, man. Edwin, write them down. See those? Those are all goals of some sort, right? Write them down. Write them down for yourself, okay? I'll go get my... Look, I don't know what he doing, but he cool now. He Gucci over there, okay? Is it Sabella? Yes, please. Oh, I'm guessing you're saying, Sabella, that I should, we could bring somebody on.
Mayo mustard ketchup?
Yeah. Cinderella says, hello, can you please explain capstone? I'm in my last semester of nursing school. Isn't capstone like doing like a big report or something? I never had to do a capstone. So somebody elaborate, because I have no idea like what a capstone is, because I personally have never done it. I thought it was more of like doing a project type deal, or if your capstone was like doing a big test. Like we didn't have a capstone, we just had an exit and we had to do it. So I have anatomy and physiology together in the same class. I thought so. Lily too says she was always an owie. I got you. Any funny work stories you can tell? Look, is it Paul or Paulie? Look, I got a ton of funny stories we could tell. Oh, I could tell at least. I'm trying to decipher because we've had so many funny ones. Like I remember one time in the ICU, like we were having a really good night and we had a wheelchair race. Like we had to wheelchair all the way from the beginning of the floor. Like we were on 2 sides, and then we were cheering each other on, and then we got all the way to the middle of it, and then we had to go around. And I don't even know what the winner got. I could just say that's probably one of the best times I think I had when we were in the ICU, because that was actually that was a funny and a good camaraderie thing, because everybody was relatively good. I don't know, it was just a good time at that point. It was a good time. Thank you. So let's see what else we got. It says you have a whole classroom there. What do you mean? You talking about in here? Do I have a whole classroom? Retirement pay is wonderful. I bet it is. I bet that retirement pay is one. You know what else is better than retirement pay? Just being retired to where you can do whatever you want. You know what I mean? Do you think I should do RN or just go to BSN? Is it RE? So here's the thing. Your RN is your license. Your BSN is your degree. You can, it doesn't matter. So you can get your RN license as an ASN, right? And so your RN, I'm assuming you mean by do my RN, your RN is your ASN, right? So you're getting a 2-year nursing degree, right? Get that. Get your 2-year nursing degree, get that RN as a 2-year nurse, and then do an online program to your BSN. Because the BSN and the ASN RN are the same RN exam. They're the same one. I haven't done a capstone either. Yeah, me neither. It's like ATI and points, and my instructor confused me so much today in class explaining that. Yeah, that's crazy. I never understood capstone because, it's just never, I never had it when I was in school. My goal is to be an aesthetic nurse. Of course it is, Ari. Of course it is. You want to go get the free Botox, the free lip injections, the fillers, all that stuff. Look, your boy don't got that problem. See what I'm saying? So I'm just playing. No, but I'm telling you right now, most nurses, women that I know that are nurses, they want to go do aesthetic nursing. So if that's what you want to go do, cool, go do you. Go do it. You got to get there first. So one step at a time, Ari, one step at a time. All right. Man, we got 58 people up in here. Oh, by the way, somebody was asking what's for dinner. Cheeseburger and fries. Oh, hot. Hot. Oh, my God. Hey, these look like these route. Oh, my God. Bro, I'm about to die out here. Jesus Christ. Woo. Oh, man. Shout out to all 61 of y'all up in here. Apparently. I almost died from this french fry. And y'all were about to witness it. And TikTok would not have liked that because it would have been against their, their community guidelines for me to, I can't say the D word. Expire. We'll say expire. So, what'd she make? Cheeseburger and fries. So, yeah, there's that. Sabella, my background, what do you mean? I have background in many things. So, you just got to look. I mean, I can tell you my whole background, Sabella, if that's what you want. It's not like I haven't said it before, but I can tell you that if that's what you like. I'm in an internship at my city hospital and got hired as an L&D nurse starting residency in January. Shout out to you, Cinderella. Is your real name Cinderella? Is it? You can tell me. You look so familiar. Been anywhere in the Midwest? I don't know. What's considered the Midwest? Apparently, I'm bad at geography. So there's that. That's what I'm doing. My ASN, then BSN, will be online completely. Completing my prerequisites now. Shout out to you. That's a plan, and that's a good plan. Hook 'em. Go Horns. Hey, we're going to the SEC next year. So I'm just saying. That's going to be some good-ass college football. I'm telling you right now. Longhorns in the SEC against, all, the most dominant conference in, college football. It's going to be great. Cinderella said, nursing students in the chat starting an internship program. Shout out to you. I made Hawaiian chicken, rice, and broccoli. Oh, that sounds really good, though. Okay, Cinderella. All right, cool. I got you. What else? Agreed. Let's go. Hey, facts. Straight facts. Shout out to all 57 of y'all hanging out in here. I'm going to be on here for another, it's 7:12 Texas time, but it's 7:12. I'll hang out here for another 15 minutes-ish. We'll go to 7:30 and we'll see how that goes. But anyways, welcome to all 52 of you guys and gals, or, whatever you identify as, Apache helicopter. And that's no shade against anybody. It's just like, well, whatever, however you feel, whatever, bro. But I love each and every one of y'all. Welcome to the live stream. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check that out. If you're a brand new nursing student about to start school, check out the 7-day NCLEX course. That link is in my bio. It's going for $48. Once you get it, you get it forever. So make sure you guys go over there and check that out. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. Are you a nurse, a pre-nursing student, a nursing student, taking NCLEX, been a nurse forever? I want to know who you are. I want all the tea about you down in the chat. I got Nurse Nelly that's down there hanging out. She is one of my co-hosts, one of many who have designated themselves as my co-hosts, and who am I to fight them? But Nurse Nelly's been a nurse for 4 years. Worked in, girl, where you worked at? Oh, yeah, you said you worked in med-surg, tele, ICU, and now she does case management, loving her life, loving her babies, and get to see them off to school every day and get to be there to pick them up. So, hey, nursing can be a great thing out here. So it all just depends on how you navigate it. It says, oh, my God, Kev, we worked on a few ortho cases when I was in San Antonio. No, we did not. Q, no, we did not. Wait, did we really? Where? Where, Q? Wait, were you in my room with me? See, that's what I'm talking about. See, look, people love me apparently, bro. I don't know why. Kofa said, what's up? Hey, bro, what's going on? Jimmy said, are you happy? I love when I find a happy nurse. So let me tell you, you want me to tell you right now, Jimmy, what makes me happy? Like legitimately, it's doing this. Like I look forward to doing this 3 times a week. I look forward to creating my course, and I 100% love teaching nursing students. Love it. I 100% love it. Speaking of that, I applied to be an adjunct instructor at one of the local schools here. So I'm just waiting to hear something back about that. Because for those that don't know, I was an instructor in the Navy. Technically, I'm still an instructor. I'm a master instructor in the Navy. I taught 3.5 years in a surgical technology program. And I also taught a various amount of different courses to include a tactical combat class. I'm a trauma nurse instructor, as well as I did BLS, ACLS, pre-hospital trauma life support, all those other ones, right? So I love to teach. I have learned over the last 8 years how to articulate my words, but also to recognize that people learn differently. And everybody, it's like having a conversation. I can't carry on a conversation with one person the same way I would carry on with somebody that I don't know until you kind of like build a rapport with them. So that's honestly, truly what makes me happy is teaching. It's just teaching people in general. But, right now, like I love teaching corpsmen in the Navy. I love teaching surgical tech students. I love teaching nursing students. Love it, love it, love it. You're located in Texas. What's a great nursing school to apply for here? I relocated from Nashville. Arden, you can look at, you got any of these community colleges, right? Any of these community colleges that are around here. You got Chamberlain that's here. Now they're here. At least I know they're here in San Antonio now. What else? Wayland Baptist is one. Of course, any of the local universities that are around you. Western Governors University, Texas A&M in Corpus Christi, UT in Arlington, Texas Tech's Accelerated BSN program, which is 12 months long. So they got a bunch. They got a bunch out here. You just got to look. Pre-nursing. Okay, how many years have I been an RN? I've been an RN for 3 years. Who gave me roses? Tia, you gave me roses? Shout out to you. I appreciate that. That's really nice. Yes, we did Navy. What? When? See, now you got, look, hey, I've been in the Navy for a long time, so I'm trying to figure out, like, when. I had a lot of stuff, a lot of people I ran into in the Navy. But we did stuff in the Navy together. Okay. Hey, first of all, Q, welcome. If, we did stuff in the Navy that long ago and you here, so I appreciate you being here. Is AL Alabama? I'm assuming that's what it is. The only thing I know about Alabama is the fact that when the shit hits the fan, you can get hit with a chair. Yo, I'm sorry. I'm not sorry because, look, it was like, y'all know what I'm talking about. Hey, but shout out to you for starting nursing school in the spring. Yeah, bro. Hi, bro. How to get RN. There's so many different ways for you to become an RN. But first, you need to figure out what school you want to go to. You need to figure out what prerequisites that they have. And you need to start doing your prerequisites so you can make sure you have the right amount of classes and the right classes to apply for that nursing school. I'm back. Sasha, I didn't even know you left. I thought you were still here. I was talking shit the whole time. This year, what are you talking? All right. We got to talk. Now we have to talk because now I'm curious because I'm just like, when? Like, when did that happen? When? Wait, your last name is Mosley? Is your last name Oh, I remember. Okay. I remember. Remember Star Wars? Let me stop. Shout out to all 52 of y'all hanging out in here. Finishing up prerequisites. I start nursing school next year in the fall. Shout out to you, Poetic. Is it Nike? Poetic. I'm just going to say Poetic Justice. You know what I'm talking about. At the chair? Oh, okay. Look, Jimmy, as long as you're picking up what I'm putting down. You see what I'm saying? So I was passing through during clinicals. I'm an HM2 now, starting school to commission as an RN. Shout out to you, Q. Shout out to you. I think I do remember you now. Usually I can put a face, but I can't really see your face. It's kind of small. So, when you don't stop talking. What you mean? Sasha, come on now. I missed you. Sasha, I missed you. I took that bite right now just for you, Sasha. Member berries. That's right. Member berries, Ari. Let me see what y'all talking about. Devontae, you picked up MESAP? Oh, yeah, I think you did tell me that. Shout out to you, Devontae, for picking up MESAP. Hey, first of all, I'm salty about MESAP. I put it in twice. And I got denied. I put it in when when I was taking pharmacology and pathophysiology. And then I put it again for MECEP when I was in my third semester of nursing school, and I still didn't get picked. So, and I applied for State 21, and I applied for the nurse candidate program, and they pretty much told me, to kick rocks. I was going to say what I wanted to say, but can't do that. I'm done with school. Which review is best for NCLEX? It all just depends on you. There's so many reviews that are out there, and I used Kaplan. There's Mark Klimick that's out there. There's mine, but it's in the pre-launch phase because you're about to take your NCLEX, so it won't be ready for you by the time you take your NCLEX. And I'm one person to admit that. It's in its pre-launch phase, so it's not ready for you yet. You got Archer, you got UWorld, you got Remar Nursing, you got Simple Nursing, you got Nursing.com. You got so many other ones that are out there. Me personally, I liked Kaplan, but Kaplan is a little on the expensive side, like $450. But it's out there. It's doable. You got Archer. That's, I think, like $90 for 90 days or 60 days. It all just depends. Depends on you. So, yeah, that's just for Sasha. Oh, will she cook us? Well, first of all, look, you missed it earlier where I ate these killer fries. They were hot as hell. Let me tell you. I'm starting nursing school in 2024. Shout out to you, Ari. I can't say, ma'am, look, why you lying? Why are you lying? You said, you were valuable on the enlisted side, Kevin. They had to say, stop it. Don't even do that. Don't do that. I was so valuable on the nursing side that I just decided just to get out and go into the reserves and just work as a nurse anyway. So that's wild. I was blessed to be picked up on the first time. All right, Devontae, just get out my chat. Get out my chat right now for the fact that you got picked up first time. Just go away. I don't even like you no more. As a matter of fact, blocked. No, I'm just playing. Look, what you mean? Ain't nobody gaslighting nobody. Stop it. Hey, no, man, but shout out to you, bro, because MECEP is competitive. You know what I'm saying? But here's the one thing that I'm going to tell y'all one thing. Well, not even one thing, but most people that know my story. When I went to nursing school, I was on active duty the whole time. I was a surgical tech instructor when I went to nursing school. So everybody that's in nursing school right now and all the things that you had to do, like study, take your test, all that stuff, I had to do that as well as do my military obligations, right? Devontae, you get picked up for MECEP. You are about to go to school 24/7, and that's all you have to worry about. Well, of course, when you got to do that PRT, so don't get fat. I don't think you're going to get fat, but you know what I'm talking about. But, that's the challenge that I had. That's how bad I wanted to go to nursing school. The Navy told me no, and I was just like, cool, I'm going to go anyway. And then while I was in school, they still told me no. I was like, all right, cool, I'm going to go anyway. You know what I mean? So that's like sometimes there are some sacrifices that you have to make in order for you to accomplish that goal that you want to achieve. And for me, I got told no twice to MECEP, once to nurse candidate program and once to State 21. I got 4 no's for me to go to nursing school on the Navy's dime, right? But I got 1 yes on my own ability to get there. You see what I'm saying? And anybody can do it. I promise you, anybody can do it. And then once people saw that I was doing it, there's like literally 4 or 5 other people that were at my command that did the same thing. They was like, hey, bro, what program are you in? Oh, they do that? Oh, yo, I got to get in on that. And then no lie, the next semester or the next year, they got into it. There's one dude, he used to work in the respiratory therapy program here at Fort Sam, and he got his degree from the same school I got mine, and his license and everything. And he's still in HM1, and he's about to retire. He has no thoughts or wants to putting on chief or thoughts or wants of commissioning. He doesn't want to do it. So I'm saying the opportunities are out there. But luckily for you, you got MECEP first time up, right? I was actually going to be curious to ask, like, what would you have done if you didn't get picked up? You know what I mean? So yeah, haters are gonna hate. Man, I wish I got picked my damn self. What you mean, Sasha? That ain't happening for you. Ain't nobody gonna pick you. Just go away. I'm just playing. Look, Sasha, you started this, okay? You started it. Just joined too, bro. What school did you go to and when did you graduate? I went to Texas A&M in Corpus Christi and I graduated in 2018. Do you think being 34 is too old to start school? Get out my chat, Ari, asking me a crazy question like that. You already know the answer. You just want me to validate your answer by telling you no. Because it's not. It's not. That age has nothing to do with your ability to get through school. It does not. I promise you. There were women that were in their 50s that were in school with me that passed. No issue whatsoever. You know what I mean? So your age has nothing to do with it. Man, I'm retired and so much better for it. I bet. Patsy, I bet. Anyone you know in Psych MP school. There was one girl that I was stationed with when I was in Jacksonville. Her name is Ebony, and she just recently graduated from Psych MP school, Cyrus. So you definitely check that out. Are you going to go for your MP? If yes, and what specialty? I am not going to go for my MP. I'm actually going to go and get my master's in nurse education. That is where my passion's at. That's what I love to do, and that's what I'm going to stick at. Because I thoroughly enjoy teaching. I'll be 29 when I start my RN BSN program. Shout out to you, because your age has nothing to do with it. None whatsoever. None whatsoever. Where's Sasha at? Sasha, where you at? About to take a note. Oh my God. Sasha, I'm just playing. That's why I went off screen. What you mean? Get off your line. You on my line. Hey, stop playing with me. Stop. Stop playing with me. All right? You on my line. I got half this cheeseburger left and it's getting cold because I'm sitting over here fooling with you. All right? Stop it. Angie said, what can I expect from my preceptor? Well, I can be completely honest with you, Angie. You're either going to expect, you're either going to have a good preceptor or you're not. There's really like no in between. A lot of people that end up being preceptors don't want to be preceptors, and so they're terrible at it. A lot of people do not know how to teach. A lot of people are not willing to teach and don't have the patience to teach. And that is the honest reality of being a preceptor. However, the one thing I can tell you to be prepared when you meet your preceptor is to come prepared. Be a sponge, be ready to take notes, and be ready to dive into taking care of your patient. Be ready to dive in, be ready to put hands on, be ready to do that head to toe assessment. Recall all those things that you learned from nursing school. Be ready for all that and be as engaged as possible. The more engaged that you are, the faster you'll get over being timid. And honestly, the faster you'll get through that imposter syndrome. All right. I'm loving all this positive. And Ari, this is what we do all the time. This is what we do all the time. I ain't about the negativity. People be coming in my chat talking about stupid shit. I'm like, hey, bro, get out. Get out. I'll give you a 600. And a 600 is essentially a 10-minute ban, a.k.a. I'm just banning you forever. And I heard a guy on YouTube, his name is the Black Hokage. Shout out to the Hokage. Y'all know what I'm talking about. Shout out to all my anime heads out there. But anyways, he gives him a 600, which is a 10-minute ban. I just say 600 and just ban you, period. So goodbye. If you had to go for NP, what specialty would you pick? That's a good question. You know, honestly, if I had to be an NP, I would have probably been a surgical NP. And I would have worked in the operating room, and I would have been the surgical NP for a surgeon. I think that's what I would have done. Yes, I already feel the imposter syndrome. Yeah, because it's real. It is very much a real thing. ORPs is my, okay, I got you. B, I just shared this with my son. He's a nursing student. So proud of him. Congratulations to your son for being a nursing student. Now tell your son that he need to keep pushing so he can be a nurse and no longer a nursing student. But he'll be all right. He gonna be good, B. He gonna be good. Who has more education? Who has more education, a PA or an NP? I think they're both relatively the same. You got to think. So they're both relatively the same. So somebody that has somebody that's a PA, they got to go get their undergrad, get accepted into PA school, and then do 2 years of PA school. Then they got to get out and get their clinicals and their experiences and so on and so forth. Now, as an NP, in order for you to become an NP, you have to work at least a year before you can even apply for an NP school. You know what I mean? So most people that apply for NP school are anywhere between like their 3 to 5 year period of them being a nurse. But now, the prerequisites are like, hey, you have to be a year of a nurse in order for you to apply. So, and then certain other ones, they have other criteria, such as, you have to do, if you want to go for acute care, you have to work in acute care for at least a year before you can apply for that one. So it all just depends. But for the most part, the education, I'd say they're relatively, I think the MP has more of the education background, I think. Get myself, what you talking about? What you mean? He in there. It says, what do you do as a surgical MP? Can you give some rough? Okay. So as a surgical MP, you essentially assist the surgeon, but you have a lot more, there's a lot more that you can do. Such as, you can, as the surgeon is like, as the surgery is finishing, you can close up the patient, you can actually see patients in clinic, just like any other MP, if you were, a nurse practitioner, like working in a family practice clinic or something like that. So, but in order for you to become a surgical MP, you have to be an OR nurse. Then from being an OR nurse, you have to go and be what is called an RNFA, which is a registered nurse first assist. And then from first assist, you have to, you have to apply to an FMP program. And once you get into an FMP program, you can specialize in the surgical route. And then once you specialize in the surgical route, you end up, working with surgeons, so on and so forth. But most individuals that go that direction already have a good rapport with surgeons in operating rooms because that's where they already work. Okay. So, man, look at that. It's 7:30. Should I leave or should I just sit here and eat this cheeseburger in front of Sasha? Y'all let me know. I ain't gonna lie. This cheeseburger good, though. So good. Mm. Angie said, you know what, or you know who knows a lot about surgery and they are not nurses or doctors yet? Vendors. Facts. They sure do. So, example, they the vendors from like Stryker, those dudes have to go to like, and depending on what type of devices that they're using, they have to go to a whole school for it. Like they have to know as much or if not more than the doctors. It's crazy to see vendors say, yeah, you need to do that. You need to do that. You need to do that. And then the doctor's like this. And I'm like, you got to be shitting me. Right. So, I know guys that work for what? Intuitive, which is that they make the Da Vinci robots. I know the guys that work for Stryker, MyTech, Agility, 3M, Boston Scientific. What's some other ones? Medline, like all these different places that make all these different devices. These vendors, they know a lot and they have to. But they're not the ones that are responsible, except for like if a surgeon does something wrong, because the surgeon is using them, as the representative for that specific device. Starting my preceptorship this semester, I'm nervous as fuck. Is it Kwanzaa? All right, Kwanzaa, what you nervous for? Don't be nervous. Is it stressful job working as an RN? Sabella, it can be. It depends on where you work. Sasha says, listen, if he coming up missing on a Navy base or his job, it was me. Wow. Well, if you take me from my job, they probably won't give a fuck. The Navy will probably be like, hey, bro, where you at? This has been the busiest live I've been on. 50 plus viewers for the whole time. That's crazy. I don't know what I did to deserve this, y'all. I appreciate all 72 of y'all rocking with me. And I don't even want to get off now. I don't even want to get off. But what am I going to do with this cheeseburger? I ain't giving it to Sasha. Shout out to all 70 of y'all that are hanging out in here. If you are brand new, my name is Kevin. Fuck it. I might just stay on here for another half hour. Hey, if you're brand new, my name is Kevin. Welcome to the live stream. I go by the Boot Nurse on all social media platforms. So make sure you guys go over there and check it out. YouTube, Instagram, Thread. So make sure you guys go over there and check that out. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Pre-nursing student, nursing student. Did you take your NCLEX? How many times have you taken it? Are you a brand new nurse? Are you a nurse who's been, a nurse for quite some time? Let us know down in the comments. You got Nurse Nelly, who is one of my co-hosts, as well as Sasha, which we kind of claim her. She'll answer some of your questions too. So you guys let me know. Make sure you guys smash that like button. I want 100,000 likes. If y'all can give NPCs 100,000 likes, please help me get a lot. I couldn't even do that right. See? Couldn't even do it right. But for a little bit about me, for those that don't know, I work in an OR. I've been a nurse for 3 years. I've been in the Navy for almost 16 years. I have 8 years of teaching background. I've taught in a plethora of other type of programs, specifically in a surgical technology program, and as well as some other programs. I'm also a TNCC instructor. So have a little bit of knowledge going on here, as well as a lot of the other nurses that are hanging out in the chat. So if you guys got any questions, ask them down below. So let's see what's going on. Angie said they make good money. I was surprised when the vendor told me what the surgeon was doing and why. Yeah, so Angie, the one thing about the vendors is that they do make a lot of money, but depending on what they do or like what company they work for, they travel a lot. They travel a whole lot. Sasha girl, we can have first of all, don't be premeditating nothing on me, okay? Nick said, how long does it take to be a nurse? It depends on the nursing school that you go to, and it depends on what type of nurse that you want to be. If you want to be an LPN, it could take as little as 10 months to as much as 14 months. If you want to be an RN, it could take as little as 2 years to 4 years. It all just depends on what type of nurse that you want to be. LPN student in NYC. Shout out to the NY. Is it Lux? Just wanted to jump on and say hello, fellow nurse. 10 years nurse in, now in F&P school. Shout out to you. What type of F&P are you trying to be? Or what type of nurse practitioner are you trying to be? Are you trying to stay F&P? Are you trying to deviate to something else? Your old nurse. It's a year-old nurse from Connecticut. I was like, my old nurse. I was like, Marion, you my old nurse? Like, I don't know you. What does it says? RN, a first year in September, or 1 year in September. Shout out to you, Miss Ebony. Shout out to you. Nelly, we already know about you. Well, they don't know about you, but that's cool. You can put that on there. RN, bachelor, graduate, about to take the NCLEX soon. Been a surgical tech for 20 years. Shout out to you, Maria. Technically, I'm still a surgical tech, according to the United States Navy. I've been a surgical tech for 13 years. I actually still have my certification. I just haven't done anything surgical tech related since before I went to nursing school. So, I mean, but you never forget. You never really forget. Do you invest in real estate? Katrina, I do invest in real estate. I actually have 2 houses, and I am a passive investor in a 168-door apartment complex. Because that is financial literacy, and that is what you're supposed to do with money. Put money somewhere to have it make money for you. That's what you're supposed to do. I'm trying to figure out if I should go to nursing school in Charlotte, North Carolina, or Southern California. All right, stop playing and go to North Carolina. You already know, and can't nobody afford to even live in California. What's wrong with you? What does it say? It says hardest nursing unit, easiest nursing unit job. It all just depends. That all just depends on, your ability as a nurse and what you like. Probably the hardest nursing unit, honestly, would probably be the ICU. The easiest nursing unit, it all just depends. It really, really all just depends on you and how you learn and, like what you like to do. I really can't say what I think is easy, because my easy may not be yours or someone else's. Just like, somebody's hardest unit, like somebody would be like, hey, the ICU to me was easy, but there's no way you would ever send me to labor and delivery, because that's the hardest thing. You know what I mean? Christina said starting LPN to RN in October, been a nurse for 3 years. I'm a nurse manager currently in DFW. Shout out to Dallas. I've been up there a few times, to the DFW area. Go to nursing school in Cali, not North Carolina. All right, cool. I mean, hey, Katrina told you. Nick said, what does a nurse normally do? Curious. It all just depends on where you work. If you're working in the ICU, you take care of critically ill patients. If you're in the emergency room, you're taking care of, priority are those trauma patients, life, limb, eyesight, massive hemorrhage, and of course, any type of trauma that comes through, and then of course emergencies that come through. Labor and delivery, you take care of mom and baby. Before baby, taking care of mom and baby. Then when baby gets here. Oncology, you're taking care of cancer patients. Dialysis, you're doing, fluid replacements and stuff like that for people that have kidney problems. Neuro, taking care of patients that have mostly neurological issues. We'll say like multiple sclerosis or Parkinson's disease, myasthenia gravis. What's some other stuff that's going on out there? Meningitis, stuff like that has to do with the brain. You know what I mean? I'm an ICU nurse planning to apply to the Air Force in Canada, flight nurse. Hey, shout out to you. Hey, because I wanted to go do flight nursing, but then I was like, nah, I don't want to do it no more. So, But I do see the helicopters, like the air life fly through, and I'm just like, damn, bro, that could have been me. Ah, well. So if I want to fly a helicopter, I'll just go on a helicopter ride. I don't know. So family nurse practitioner. I'm done with his old self. Ma'am, stop. Do you invest in real estate? Katrina, I already answered that question. Oh, there's like 27 things on here. Lord have mercy. Family nurse practitioner wanting to specialize in derm. Do it. Do it. A 16-month accelerated BSN nursing graduate in December. Shout out to you. Michael said, I just passed my NCLEX last week. Shout out to you, Michael. Everybody give Michael some love. Give him like a round of applause. Tell him he's awesome. And then tell him welcome to the shit show. I mean, welcome to nursing. Welcome, welcome, welcome. I still gave mine too. Okay, shout out to you, Maria. Passive investor. So here, see question above. I don't know what that question is. I'll go back to it or it'll post it again. Nautica said a passive investor. So essentially you invest money into something and it makes money. So I don't have to actively do anything with it. It makes money every month. That's what passive means. Did you say you're doing Airbnbs? No, I did not say that. Nautica says, give me the deets. What kind of deets? Congratulations, Michael. I was just pinned August 3rd. Oh, okay. I got you. Tips on studying for the NCLEX, please. I'm guessing you said, what is the best Mark Klimic and UWorld? Mark Klimic is great for, like remembering like little things, like having kind of like little ditties, so to speak. An easier way for to remember. And UWorld, they have NCLEX style questions. Me personally, I did not like UWorld because I like just reading them. I needed more than that. So for me, I needed more content, and UWorld doesn't provide that. At least to my knowledge right now, they don't provide that. So ICU hardest second would be NICU. Yeah, anything critical care is definitely going to challenge you. Ambulatory, yeah. Oh, ambulatory is probably easier. Let's see. That was a good political answer. I don't even know what I said. What was the political answer? I'm from Cali and I currently live in New York City, but over it. Yeah, first of all, you went from one expensive place to another expensive place. Girl, go to North Carolina. Stop playing. Gotta go, but love the live and everyone here. Enjoy your First of all, Angie, I don't even know if you left yet. But parts of it is still warm, okay? So let's see what's going on. You were active duty while in nursing school. Nautica, yes, I was active duty in nursing school. I'm thinking of staying ICU, trauma RN, and part-time paramedic. Why would you do that to yourself? That's a lot. I hate ortho and neuro. Gillian Bards. Oh, yeah, Gillian Bards is a no, yeah. Yay. Welcome to the shit show. We're short staff and crazy ratios. Facts. Definite facts. CV ICU or trauma or neuro ICU. It all just depends. Like CV ICU, they consider themselves they consider themselves the cream of the crop when it comes to the ICU like type of status. I would say try all of them. I know that most people that go CV ICU, they go to CRNA school. And the CV ICU definitely helps people get through CRNA school for sure. UWorld passed in 75 questions. Shout out to you for passing 75. Well, when it was 75 questions. I used UWorld from my first 2 or 3 times. Didn't work for me. Miss Corey said, thank you. You're welcome. What it says, it's not preparing us. What's not preparing you? Best online school for nursing, Chamberlain, WGU, Nightingale. Chamberlain, I've heard iffy things. Western Governors, I've heard a lot of great things. I've heard about Nightingale so many times, but I've never personally even looked at that website for Nightingale at all. What is your advice for studying for NCLEX? Best way to prepare? Well, Miss Corey, first thing you want to do is you want to recreate the testing center. Like you want to recreate what your test is going to look like, period. So that's the first thing you should do. No drinks, no phone, no nothing. Time management. You need to literally audit your time. You got kids, get rid of them. I'm just playing. Don't get rid of your kids. If you got kids, you have to audit your time on what you're going to do with your children. You have a job, you got to audit your time on how you're going to study appropriately when you have a job. What does your study plan look like? Like what is the hardest section for you when it comes to studying? You know what I mean? So like for me, it was pharmacology and maternity. So I know when I started doing my quizzes, or when I started doing my content, I did pharmacology first. I started there because I already knew pharmacology was a monster. And by the way, for all those nursing students and all those brand new nurses, do not, and I repeat, do not forget that your pharmacology will not go away. Do not data dump pharmacology, because anybody I'm going to say her name again. Anybody know about Redonda Vaught? Hey, if you don't know about Redonda Vaught, I'm going to need for you to look her up. You can even misspell her name in Google. It'll be like, do you mean this woman? Like, I'm just saying, know your pharmacology. Know it, know it, know it. How is LPN school? I don't know, Rita. I've never been to LPN school. So your pharmacology, know it, know it, know it. But back to your question, who was it, Miss Corey? What did I say? Oh, do NCLEX style questions. Do your NCLEX style questions. You want to read and you want to review your questions after the fact, and you also want to do content, right? So when it comes to your content, do you understand it? Do you know how to apply the content to the question? Do you understand what the question is asking? Those are the things that you need to do in order to prepare. And the best way to do that is to create the testing center and practice, practice, practice. Come up with a study plan for yourself. Come up with time management for yourself, like when you're going to study, when you're going to review, when you're going to do content. And you get that, you get it regimented. Do it every single day. Give yourself a week. I'll give you a week. Give yourself at least 1 to 2 days off during the week, because this is a muscle and it needs to relax, right? Because there is such thing as data overload, right? And you don't want to be sitting there like, you don't want to be sitting there fog brain, you know what I mean? Or a foggy brain. Y'all know what I'm talking about, right? So hopefully that helps. Okay. Don't go to Cambridge. Cool. I won't. I will not go to Cambridge. About to start a direct entry master's degree program. Question about MSN RNs in the hospital, or if there's a difference. There are MSN RNs, because your MSN is your degree and your RN is your license. So, you're at a mastery degree level. So essentially what you have in your master's degree, it opens up opportunities for you, like at higher levels, to work at as a nurse. That's essentially what it does. But with the direct entry master's degree program, you're going to go through the program, essentially the nursing aspect of the program, and then you're going to take your NCLEX just like every other nurse. If you don't pass that NCLEX, you do not proceed through the rest of your program. Okay? So you're going to get the nursing stuff, and then whatever your master's degree is specialized in, that is exactly what you're going to get your master's degree. So it could be nurse leadership, and there's some couple of other ones that are in there. Miss Supreme, I'm interested in clinical research. Is that possible straight out of nursing school for LPN or RN? I believe if you want to do nursing research, that's more on the RN route, but I'm not sure. Oh, he's back. He's back. I don't know what's going on. You guys hear him? You guys hear him out there? He crazy. He crazy. Shout out to all 60 of y'all that are hanging out in here with me. If you guys are new, welcome to to whatever this is. This is a French fry, but that dude is my son. I don't know what he's doing out there, but welcome to TikTok Live. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go check it out. Make sure you guys go check my YouTube out, subscribe to it. Also, if you are a brand new nurse about to start nursing school and you want an NCLEX review that's going to be ready for you in the next year or two when you graduate to prepare you for NCLEX, check out the 7-day NCLEX course. The link is in my bio. You get it for $48. You get it once, or you pay for it once, you get it forever. And it's 80% off the normal price. So make sure you guys go over there and check that out. And right now, I don't know why I keep pointing this thing at y'all like it's a pointer on a chalkboard or a whiteboard. Chalkboard, they don't even use chalkboards anymore. That's wild, ain't it? It's wild out here. Wild out here, let me tell you. So, let's see what we got. It says, welcome the baby boots TikTok. He in there somewhere. Anytime he comes here, it ain't my TikTok no more. It's his. Hey, I'm gonna legit get off here in 12 minutes. So whatever questions y'all got, let's hear them. Can you talk nursing at, is that Rasmussen? I don't even know what that is. I don't even know where that is. Where is that? Give us a little bit more context about that school, about is that Rasmussen? Give us more context. Tell us about it. Who said hello? Nikki said hello. Hello. And it's all because of Nikki. I'm sorry. I couldn't help myself. Does anybody even know who that is? Anybody even know who I'm talking about? The queen of all queens. We have it here in Florida. See, now you're about to make me do some research. But Sasha already did it for me. Shout out to you, Sasha. You know what, Sasha? I was going to eat this cheeseburger in front of you, but you done already answered that question for me, so I appreciate you. I appreciate you. Man, y'all got me to 19,000 likes. Hey, give me to 20 right now. Go to 20. Go to 20. Go to 20. All right, I'm done. Enough of that nonsense. You're about to be... that's what I'm saying. I think that'd be the most likes I think I've ever gotten. Honestly, this is the most people that ever sat here and listened to me talk. I don't even know why I'm yelling because y'all are right here. You see what I'm saying? Hey, anybody part of the Slytherin gang? You know what I'm saying? Slytherin gang. Straight up. If we're talking Harry Potter, it's all about Slytherins. I'm just saying. Y'all, hey, I'm just saying. Well, good. My damn thumbs are tired. I'm sorry, my bad. Is your name Scion? It's Scion, isn't it? NCA is CNA or MA job good for those who want to get into nursing school? Yes, they are. Because they will make you more familiar about what you are going to see when you are in a hospital. Well, Nelly, don't hurt your thumbs. We don't need you getting carpal tunnel now. Sasha, you would be. Sasha, you a Scorpio too? Let me not do that. Because we ain't bringing astrology or anything or any nonsense like that up in here. We ain't doing all that. We keeping it real. We keeping it logical. You see what I'm saying? So that's what we do. Shout out to all 63 of y'all up in here. What questions do you guys have? Where are my brand new nursing students at? What are you guys worried about? Where are my new grads at? What are you guys worried about? We know imposter syndrome is a very big thing. And we know that you guys are nervous, but you guys are going to do all right. All right. And everybody's surviving this heat because, it's like 100 and yep. That's exactly what it is. Sagittarius, gross. I mean, that's cool. I'm going into my last year of school. Shout out to you. Is it Kiara? It's Kiara. Kind of like what's her name? Kiara off of Lion King. A word about picking between adult trauma ICU or NICU. Just try one. Who said that? Tommy, just try one. Guess what? If you go to adult trauma ICU and you don't like it, go to the NICU or go to NICU first. And if you like it or you don't like it, then, go to adult trauma. That's the great thing about nursing is that you are not like chained down to one specialty. You know what I mean? I've worked in 3 different areas. You know what I mean? So if you want to go try one. And then if you do it for a year or 6 months, you can be like, nah, bro, this ain't it. Or if, you want to Randy Jackson your way, like, hey, that's enough for me, dog. Like, I can't do that. Then that's what you could do for yourself. We might get rain tomorrow. Yeah, we ain't getting rain tomorrow. That is going away. You want to know why? The sun is just like, nope, absolutely not. I need tutoring for psychology. Well, they got a lot of stuff out there. I would definitely check out. If you want some really good understanding, just go to YouTube, type in everything about psychology for nursing or psychology, that class, and you'll learn learn everything that you need to know. I'm almost 100% going into peds. Well, I'm almost 100% you're going into peds too, Kiara. If that's where you want to go take care of them babies, because me, not so much. I start fall semester in 2 weeks. Worried I won't be able to balance work and school. So is it Hello Wendy 96? Whoa, hello Wendy. The one thing I'll tell you is if you're worried about, okay, so you already know that that's a problem. You are not a problem, but you already know that's an obstacle that you're about to face is work and school. So you already know it. You already know that it's an issue. But you start school in 2 weeks. So what are you about to do about it? How can you plan ahead before you get there? You know what I mean? Think about that. How about advice for students during clinicals and then as a new grad? Well, essentially the same thing I would tell somebody going through clinicals, the same thing I would tell a new grad, Kiara. As a nursing student in clinicals, definitely be a sponge, ask questions, and get in there to be a part of the team. Especially if you have a really good preceptor that loves to teach students. As a new grad, Now it's a little bit different because you have a license. I would tell you the exact same thing because you're going to have a preceptor. Dive in there as fast as possible because the faster you get in there, the more comfortable you'll be. All right? Be a sponge, take notes, get into a routine. That is the biggest thing. Getting into a routine, because the moment that you get into a routine, you have better time management, especially if you work during the day. During the daytime, you have to have specific things done by a specific time before these doctors start to come around, or PT starts to come around, or they got to have dialysis, or caseworkers coming around, stuff like that. Getting a routine, getting your time management down, right? And never forgetting your pharmacology. Never forget your pharmacology. I can't even tell you how many times. Look, hey, y'all want to hear one crazy thing that I almost did, legit? Is I want to say, not in fundamentals, I think it was in MedSurg 1, and she was just like, yeah, we're going to give 2 units of insulin. And I'm just like, cool. So not my dumb ass pulling up 20 units. Y'all hear me? I pulled up 20 units of insulin. Do y'all have any idea what the hell that would have did to somebody? And so luckily for me, I had such a good preceptor. She was just like, she didn't even yell at me. She's like, where are you going? And I was just like, I wanted you to check this because that's what I was always taught. And she was just like, oh no, 20 units? What you trying to do? Get us both locked up? And I was just like, oh my God. And that's all because I was nervous, right? And she kind of sat me down and we talked about it. And she was just like, now that you know, we're not going to do that. So you're never wrong if you ever get somebody to verify a medication that you have. So anytime I used to give insulin, didn't matter it didn't matter who it was. I was like, hey, because I'm slow, that's 2 units of insulin, right? And they're just like, yes, 2 units. Cool. Because now when I do my charting, I go in there and I would say, administer 2 units of Lispro or insulin Lispro, and like left lower quadrant, and I put verified, or second nurse verified, and I put the nurse's name in RN. So that way she'll be like, oh yeah, I looked at that. Yep, because you sure did. You know what I mean? So that would be my advice as both a nursing student and as a new grad. Hopefully that answered your question. Did you have any interest aside from nursing? I'm torn between nursing and radiology. Hey, Jordan, did you know that you could do radiology as a nurse? Did you know that? Did you know that, Jordan? Jordan, did you know that? Do you have to be good at math? No, you don't have to be good at math. You just have to really understand the dosage, like the conversions. And it's simple math, dividing and multiplying. Pharmacology is key. Facts. So you can actually go work. You can actually go work in radiology as a nurse. Like you could be a radiology nurse. You can actually be like a radiology like nurse practitioner, if I remember looking at that right. So if you go to nurse.org and you look at their certifications, there's like 200 of them. You could literally work in radiology as a nurse. But not a tech. You can work in X-ray as a tech. Oh, do you mean like as a CNA or like a medical assistant tech? Is that what you mean, Jordan? What's it? Country club girl. I've been an ICU nurse for years. Rule of thumb: if you don't document, it didn't happen. Facts. Let them know, because if you don't document, somebody look. Okay. No, sorry. Technologist taking the photos. What? I'm lost. Oh, you're talking about being a radiology tech, like an X-ray tech. Any tips for LPN student? I start school next Tuesday. Well, be a sponge. Be ready to learn. Cut out everybody in your life that is of no importance, because it is only going to be your name on this degree, no one else's. Have good time management. Also, understand what type of learner that you are. Okay, like, are you a read write? Are you a read write, auditory, kinesthetic, visual? Are you a combination of all of them? So make sure you understand those. Okay, and and one other thing I would say, and this is for everybody that's about to start school, get into a small group. And by a small group, I mean no more than 4, to include yourself. That way, when you guys are in class or in school together and you guys are getting ready for a test and you at least know like what areas to focus on, you can split them up 25%. And then you guys can bring them all together. See what I'm saying? You can bring those notes together. See what I'm saying? So think about that. All right, I'm going to answer maybe one or two more questions and I'm going to get off here. Tips for dealing with bad/mean preceptors. I had one last semester and it was rough. Well, I'm going to tell you right now, I don't deal with mean or bad preceptors. However, we never know what they have going on. They could be having a bad day, or they could be having a rough day, or they just suck at life. And that's just kind of just one of those things. Stace, you're welcome. So here's what I'll tell you, Kiara, is if you ever experience a bad preceptor and you're stuck with them, start taking notes. Get their name, let them know everything. And then let the charge nurse know how they were. And then after that, let your clinical instructor know, because then your clinical instructor, if they're a good one, they're going to go to the manager and they're going to let them know, like, hey, this person was rude to my student. This person was doing this, that, and the third. And then hopefully that'll get rectified. And then the next time you go to clinicals, hopefully you will not have, or, hopefully they won't have that same preceptor. Yeah, the group's 100% are gold. EK, thank you. You're very welcome. Hey, make sure, there's 52 people in here. Y'all better all follow me right now. All of y'all, right? You're welcome, Kiara. All right, y'all. Hey, I was on here for what, 2.5 hours? I don't even know. I don't do math. I don't do math well at all. But anyways, I appreciate everybody that decided that they wanted to come and hang out and listen to me run my mouth for the last, I don't know how long. You guys are all very welcome. Thank you guys all for stopping by. One last thing I'll say to you guys is be good to yourselves. Be good, be kind to yourselves. For my nursing students, you guys are about to embark on a journey, but just take it for what it is, because, No, bad advice. Go directly to your, why? Why would I go directly to my clinical instructor if I could take notes and I tell somebody? I wouldn't say that's bad advice. That's subjective. But anyways, Lupita, you are entitled to your own opinion, but I didn't say, I go straight to my clinical instructor and I tell the charge nurse. Because that's what I did. So anyways, I hope everybody has a great rest of their week. And I will see everybody not next week. What am I saying? I will see you guys all on Wednesday. So be kind to yourselves and I'll see you then. Peace.